sound. them upstairs for snacks.
As
So
we will,
need
as
to
you're doing the
announce.
closing remarks.
Yeah.
empowerment and support for those affected by endometriosis. Today, we gather as warriors, advocates, caregivers, and healthcare professionals, all united by a common goal to raise awareness and create a future where endometriosis is better understood, diagnosed, and treated. Endometriosis affects millions worldwide, yet too often the voices of those who suffer go unheard. But today, we stand together to listen, learn, and inspire change. Whether you are here to gain knowledge or find a community, know that you are not alone. Throughout this event, we have incredible speakers and interactive sessions. We encourage you to engage, ask questions, and most importantly, support one another. Thank you for being here, for your strength, and for your commitment to this cause. Together, we are not just raising awareness, we are shaping a future where every endometriosis warrior gets the care and recognition they deserve. Let's make today a powerful step forward. Welcome to Endometriosis Warrior Unite. Welcome to Third Pack. So my co-MC is Anne Sokoto, our marketing manager. At the back, I have my team, Virginia, client liaison. I have Yvonne, she has stepped out, our assistant administrator. I have Daniel Nyakundi, our cameraman. I have our acting COO, Dr. Preet Patel. And then I will introduce the next speaker. You can clap for my team. So the next speaker is an amazing woman. She is Mildred Othiambo, a nursing background experience of over 30 years, 15 years in hospital management. She is a cancer warrior, mother to many, including us, volunteer in laparoscopy machinani since 2018, passionate about supporting endometriosis patients and warriors, and acting CEO of Third Pack Hospital. Let's give a clap to Mildred.
Thank you very much, Felicitas, for the introduction. Good morning. How are you feeling? That's nice. We want to feel good. Even when things are not okay, we would really want to make them manageable. That's our intention every day. I've been introduced, and my role is to introduce Third Pack Hospital. Third Pack Hospital is 3 years old. It was opened in 2021 November. And we thank God for his grace and growth. And it was intentionally set up to be able to offer advanced surgeries. So we are mainly set up as a surgical center. So you will not find a patient coming here with malaria or with a cough. So it was very intentional to set up a surgical center that is able to offer advanced procedures. And so everything that was done with that intention. The owners of the facility invested in very high-end laparoscopic equipment because it's easier to diagnose and to treat advanced surgeries with minimal invasive surgery. So what does that equipment do? That equipment does is that it improves precision and visibility. You see, like when you watch a 3D movie, you are inside the movie. That's what 3D camera also does in laparoscopy. So you're able to see details of disease that you would not have seen with your naked eyes because it's magnified. So when you're able to see details, then you're able to do a better surgery, better removal of the disease that you want to perform. So we perform all surgeries, laparoscopic and non-laparoscopic. So we don't do eye surgery. But we do ear, nose, and throat. We do dental surgeries. We do gyne. We do general surgery. We do all surgeries. We do orthopedic surgeries. We do quite a bit of spinal surgeries. But any surgery that requires minimal invasive, we are doing that at a very advanced level. So then that gave an opportunity to be able to improve endometriosis care. Because then you're able to have whatever small disease is in the lady's abdomen magnified at a certain level, so you're able to identify it and do a better excision than if you're doing with your naked eyes. So that has advanced our endometriosis as well as colon cancer surgery. So we are also able to do very advanced colon cancer surgery because of the equipment. So we're also very intentional about making a difference. And endometriosis is one of the areas that we started focusing on. So we are intentional about having centers of excellence in various specialties. We started with endometriosis. So what does it mean to be an endometriosis center? It means that we want to be intentional about your care. What is your need? One is pain. The second one is that this pain traumatizes. So it affects you psychologically. Yeah? It affects different parts of the body, so it does not require only one specialty. So we have a group of specialized surgeons in all areas. So if you have a patient who requires gynae and there's a nodule in the bowel, you have a general surgeon, and there's something in the bladder, you have a urologist, and there's something in the chest, you have a cardiothoracic surgeon. So then all these people are able to come together and perform the surgery and give as much help as the patient is able to require. So we also provide counseling support within the hospital. You'd be asked whether you require counseling. There are people who require support at different stages. We also work with physiotherapists. We have a chest physiotherapist for those who require that, and we also have somebody trained in lymph and pelvic physiotherapy. Now, one of the things that the disease does is that it's a disease of inflammation. So when it causes inflammation, muscles get tight. You know, when we were children, we would fall, and you have a black scar. The skin has gotten a bit tight. So you can imagine if that continuously happens inside your abdomen, things get a little tighter. So the pelvic physio also helps to be able to do that. So you might not be having surgery, but you're feeling very uncomfortable. Even if it's just pain you've been handling and you're having medical treatment, it is okay to have pelvic physio because it helps you release a bit of that inflammation and help you manage pain. It will also help you manage the back a bit. So then that helps you to manage pain. So we are very intentional about taking care of your pain, taking care of your psychological bit, taking care of the disease in terms of surgical excision, and just trying to see how best do we support you. So this is the first chat we are having. But last year, we had a chat with those we operated in 2024, 2023, meeting those who are coming for operation in 2024. So within the year, we have 2 sessions. We have Endometriosis Awareness Month. This is the Endometriosis Awareness Month. And then we have the marathon. We do a marathon in October. So what does that mean? So in 2023 and 2024, during this month, we were doing ultrasound. So we advertise for free ultrasound for patients. But what that does is that it also gives the surgeons an opportunity to see many patients with the disease and improve their skills. So we are intentional about improving skills, not just for our doctors, but other doctors you will meet wherever. So we also train doctors on improving ultrasound diagnosis through ultrasound. So then whenever they meet a patient, they're able to tell early enough that this patient has signs of endometriosis, so how can they be helped? So we did ultrasounds in 2023 and 2024, but this month we were doing it differently. So we had a number of activities which included going to school. We went to one of the schools here, High Ridge High School. Though last year we also went to 2 schools, but we went to one school here, and then we decided, why not have a chat with warriors? So what do we do in October? In October, we do surgeries. You all know how expensive these surgeries are. And I said we are intentional to support. So because the surgeries are quite expensive, there are patients who are able to do, based on the surgery they require, they're able to have their surgeries done anytime they need the surgeries. But there are those that are struggling to raise the finances. But you're still trying to see, should we leave them because they are struggling? No, how do we help them? So in 2023 and 2024, we've been rallying and campaigning and trying to get people to support us financially and say that, okay, number one, doctors' fees not being counted there. The doctors are volunteering. We're doing a camp, so the doctors are volunteering, so they're not charging their fees. So how do we manage hospital fees? We try and get support so that then, what we've done in the last 2 years, we are able to get 20-30% reduced from the patient's bill, so that then they're able to manage the rest and able to have the surgery that they need. So during those camps, we try and get finances and do many patients within that month of October. So that's how we had the patients who were operated in 2023 coming to chat with the ones who are coming in 2024, just to tell them how has it been after the operation, how has the journey been, and what difference have they seen, to motivate each other and just to encourage each other also. We're also encouraging support. Thank you for the men in the room. We know how this is emotionally draining, and we're just trying to see how do we encourage support, whether it's from siblings or boyfriends or spouses. It's a journey you can't journey alone, you know. So we are encouraging support and trying to see how do we have this conversation around support as well. So maybe the next conversation we will be having will be, have you had a sibling or a girlfriend or a spouse with endometriosis? Come, let's talk and see how can we be able to give them more support as they journey through life and have their treatment done. So I am honored to have Arti and the entire team here. We really appreciate that you are able to come. We hope that this day will be beautiful and just warm. Please feel loved. We love you. We care about you. We just want to support you. So it's not about coming to hospital only. We just need hugs. We can stand and hug the person next to you. Just hug the person next to you. Tell them I love you. I love you, Arti. I love you, my dear. How did that feel? Yeah? That's what we all need in good and bad times. So just telling somebody, I know it's tough. I might not know what you're going through. I might not be there with you when you're having sleepless nights, but how can I support you? Just telling you that I love you and understanding you and journeying with you and trying to see what it is I can do for you. We had one of the clients saying how they were feeling. I don't know if you watched our session on NTV. In fact, it's one of the presenters in NTV saying that the brother used to fill for him plastic bottles with hot water. He knows it's that time of the month. That's love. That's all you need. He doesn't need to buy a hot water bottle. What is there that he can support you with? And that's what you would want to do as a hospital. Other than offering treatment, you just want to show love and support and care and see how can we help? How can we make things better? How can we make things easier? How can we make you have good treatment that is giving you good results, that is adding value to your life? Because when you are sick and coiled in your bed, you feel things are passing by and you're not able to do them. How can we just make you live on? Yeah, that's all I'm going to say for now. Thank you very much. Please feel very welcome, feel warm, feel loved, and just enjoy your stay around today.
Thank you, Mildred. We really appreciate. Thank you for the love. A little bit of housekeeping. Our washrooms are at the reception, straight ahead, the last door on your left. That is where we get network for the washroom. Karibuni sana. If you need water, at the back, behind where Virginia is, there's a dispenser or any other kind of assistance. The team with third pack logos will be able to assist you. I want to introduce our next speaker. She's our special guest speaker. Her name is Arti Shah. And as dietitian, certified counselor and an endometriosis patient advocate for over 10 years. Having battled endometriosis for over 25 years, enduring a 12-year delay in diagnosis. hormonal treatments, and multiple surgeries. She deeply understands the emotional and physical toll it takes, including the silent struggle of mental health. Through her work, Arti integrates play therapy, a psychosocial intervention to support warriors in navigating the mental and emotional impact of endometriosis. Her journey has shaped her empathetic approach as a counselor, allowing her to connect with and uplift those facing similar struggles. Fueled by her own experience, Arti is passionate about ensuring that the next generation does not have to endure the same battles due to lack of awareness. With her mantra, turn the pain into purpose. She's committed to reshaping the conversation around endometriosis, advocating for better awareness, management, and support. Let's give her a clap as she comes.
Thank you so much, Felicitas. And thank you, Mildred. Has Mildred left the... Oh, and I wanted to act on what she said. So before I continue this session, Brian, you ready? I just want to take a moment of silence for Jambi, our fellow fallen warrior. She was very close to my heart. It obviously makes me emotional, so just a moment of silence for her, and then we continue the session. Okay, and all our fallen heroes for especially endometriosis. Okay? Thank you all. Thank you. Sorry, that always gets us all emotional. All right, so first of all, thank you all. Welcome to our event here. I would really appreciate Third Park Hospital as well. And when Mildred was saying that, this is not just the hospital for you to come and do your surgery. I've had my surgery here now. I had it 3 months ago. So I understand what they mean by not only patient-centered care for the excision specialists involved, but from the staff to the housekeeping to the chef to the admin. I mean, the care that I've had multiple surgeries. I think this was my 7th surgery or 8th, I can't remember. But it was one of the best, and I can actually now compare it to an excision surgery that I had abroad 2.5 years ago, and I was just blown away. I mean, we have 2 top excision specialists for endometriosis here in Kenya. We only have about 150 endo specialists around the world. From that, 2 of them we have here. We do not need to travel abroad, because let me tell you, the burden of traveling abroad, not only the finances, but there's nothing like recovery at home. The recovery, the post-travel, the pre-travel, oh my God, it's a nightmare, And the fact that we have it here, I mean, it's a milestone for all of us as an endo community. So kudos to Third Park Hospital for being the center of endometriosis in Kenya. Well, in Africa, for now, right? Okay, cool. Anyway, so welcome. Thank you. Okay, so this is basically a session. My segment is a session of counseling. I'm not going to go into my details because obviously Felicitas did a great job of introducing me. I battled this condition. We've been, Doris here is the founder of East African, Endo Sisters East Africa. So we have been working together with her team. We've been working as advocates for a very long time, for over 10 years. So I actually am a certified, I've got a diploma in forensic psychology and counseling. So I decided to take on this journey because I understand the mental toll that it takes on your body. You know, far too often it's always like, oh, you've got painful periods, or, you know, just get on with it, get over it, without realizing the demon that endometriosis is, the demon that the co-sister adenomyosis is, and the mental toll, apart from the financial, it plays on our lives. So again, as Mildred said, thank you to the men in this room as well, because it's incredible to see the support that you're giving. Like, seriously, it is amazing. So thank you. Okay, so now I've got a whole set program which I'm going to tweak it based on all your energies. How are you all feeling today? I can't hear anything. I can't hear. That's not the energy that I want. Listen, I'm just recovering from a really bad double flu. So if I can shout, and I've just thrown up before I started this, so come on, you guys can give me that, a bit more energy. How are you all feeling? Yay, that's more like it. Thank you. All right, so today, look, understand that we're creating a very safe space. It's a space of healing, non-judgment, and just safe. So feel how you feel. Let your emotions play, let them surface, and just know that you're in a very protected environment. Okay? As much as I've kept it in a level where, because it's also online, I'm not going to go into the depth of it, but the way that I've done this program is that it's going to help whoever's watching as well. Okay? So please ignore all of the rest and just do this for you. Okay? Forget, cameras are going to be there. Do you know what? Why shy from what we bloody suffer with endometriosis day in, day out? And this is not only for March. Okay, the tools that I'm going to try and give you today, and the exercises that we do, I want you to practice them when you feel overwhelmed, because it is a very overwhelming session, 365 days a year, not just in the month of March. Okay? Are we clicking or are we cheering? What are we doing? Cheer then, come on. No, as in woo to yourselves, not to me. All right, so I want to start with, this is basically endo journey in one word. Okay, you guys have got paper and pens. For those of you who don't have the pen, then just borrow a pen from your neighbor just to jot it down, please. Okay? We're good? No, sharing is caring. You don't have to, if they only want one, let them have one. I know. All right, basically what I want you guys to do is write down in one word how you capture the journey of endometriosis. It can be a feeling, it can be an emotion. Just write down one word, how endo has made you feel. In terms for the supportive partners, you can write down what you think you have seen, or what you feel in one word describes what their journey has been like. Okay? Like, for example, my word would be resilience, as much as it's so common. But majority of us find resilience. It can also be a challenge. Are you all good? Have you all written it down? I'm going to go around so you guys can tell me what that word is, because this is the whole practice. We want you to talk about it, okay? Because, in form of play therapy, what we're taught is also when you write some, it's not only play therapy, any form of counseling or therapy, when you write an emotion down, you don't know the amount of the heaviness it has come out when you've written it down. You say it out loud and then you talk about it. It might release emotions that have been bottled up. Okay? Sorry. Say it out loud. What was your word? Blur. I like that. How many resonate with blur? Hands up. Be confident. Listen, we're here to beat this damn condition, okay, as much as we can. Huh? Say it out loud. Say it like you know you want the damn thing out of your body. Nice. How many of you have felt it like a roller coaster? Would you want to go in depth about it or even blur? If any one of you feel like you want to talk, elaborate on the word that you've said, you feel free, because this is an exercise that is going to release a lot of bottled up emotions. Are you okay? Sorry, let me go back to me. Are you okay with your blur?
Yeah.
Do you want to elaborate on it?
So blur, because I'm currently cramping, so it's just like feeling.
Oh, fair enough. Thank you.
Well, roller coaster because there are ups and downs. There are good days, there are bad days. There are days we bottle up those emotions. We were just actually exchanging. We were talking with Flora the other day, and we just came to realize that the majority of the things that we deal with, that we don't get to talk to people, and the fact that we want to talk to people, but that days we just overwhelmed enough to just approach someone and be like, okay, I'm not doing well, I'm not okay. So that's the roller coaster definition of me. I have people who are at the front and ready to support, but there are days I can't get myself to approach them to support me. And I shove them away. I'm just like, go away, just stay away from me. Yeah.
And that's absolutely okay. You're validated to be that way and to do that way and to feel that way, because it's not that you don't want to, it's just that your body and your mind frame doesn't allow for that space to open up. So days like that, what you can do is just go in the front of the mirror and just swear if you have to, or just talk how you have to, because that person that you're talking in front of the mirror is a reflection of you. Yeah? So just feel free to do that. I can see the emotions creeping up. I can see them. Thank you.
Okay. Mine. Okay.
Yeah, it's on for the...
Okay. All right. It's okay.
Just speak louder, though.
Okay. Yeah. Mine is overwhelming, and I'm in menopause, so this is way. I've gone back to that moment, but overwhelming because we had no support at that time. There was no one to talk to. There was no information about Endo. It was such a lonely journey. So there was no. When I look at it now, people have support. There are resources. There's information and all that. There was none of this at that time, so it was pretty much overwhelming. Yeah.
No, thank you. It's true. And this is the reason why we do what we do now. The reason is that for advocates to be doing this is because it's very easy for all of us to even just say, you know what is it to us? Why should we host these things, or why should we advocate? But because we don't want these future generations and you all to be going through what we all went through back in the day, where there was nothing. I'm sure it was there, but the awareness factor wasn't as much as it is, especially now in the last 7 years. Yeah? Thank you.
Okay. The one word I came up with is exhausting. You may think, how do I put it? When people see you moving around in whatever space, the neighborhood or at work, they may think you're all, everything seems so okay with you. But ideally, there are so many struggles that you have to endure. And then there's just also a lot of people who come up with a lot of, is it more like information? Some people who have no idea what the disease is all about.
Unsolicited advice.
Yes, exactly. Or what they think, how did you got it because of this, or, all that. So it's just so, it becomes now overwhelming. And also it affects you mentally, physically, emotionally. So it's just so difficult to handle. I don't know. I don't know if others feel the same. It's just, you think you're strong, but no.
No,
Yeah.
you are strong. It's the unsolicited advice from people who are trying to help you but don't know any better and haven't done the research or understood the illness that make you feel that way, because don't doubt the fact that you are strong. Endo warriors who fight this damn battle are strong as hell. Yeah, because I know for a fact from ladies who have had children and gone through labor and who have had endometriosis have said labor was nothing compared to endometriosis. All right? So you are strong. Don't doubt yourself. And this is why we exaggerate on the fact that all patience must be learned patience. You have to do the work. You have to, so that unsolicited advice from strangers or even your own family, it doesn't affect you, because it's such an isolating illness. It is such an overwhelming illness that, we don't need that, but unfortunately, we live in a world where we're with human beings, right? It's going to happen, whether we like it or not. Yeah? But you are strong. You're very strong. So never doubt that.
Okay, for me, I think it's a scary thing that I'm going through right now. I don't know how to express it most of the time. So that's why I've come here today.
I know, I can hear it in your voice. It is a scary thing, but unfortunately, what we need to do in this journey is befriend Endo and Adeno. Befriend it in a way where we will kick that bee out of the planet, but we have to make it, we have to befriend it. We have to befriend it because, Mildred, can we have some tissue, please? We have to befriend it so that, the thing is this, fear makes us act in panic. Yeah, the minute we act in panic, we think we're making the right choices and decisions for our journey, but unfortunately, with all those emotions put together, we end up taking wrong advice for ourselves, because then we take so much advice from everywhere else that we get confused. Yeah, so if we can friend it and it's a process, it doesn't come overnight. And it's okay to go through these emotions. It's okay to be scared. Yeah? Like I get goosebumps just, talking about, I don't know how you all are feeling, but I'm getting goosebumps here. So it's okay. And let me tell you, even in the fear of it and even in the scariness, you're all brave. Okay? You're very, very brave. Next. Where did that microphone go? Oh,
Yeah.
sorry. Sorry, sweetie.
It's okay. My name is Doreen. I wrote tired.
It's okay. It's all right.
But,
It's all part of the process, and this is why we're doing this exercise. Let the emotions come out. Let them flow.
I guess it's been a very frustrating journey. From the long journey to diagnosis. I mean, I remember being in high school a few years ago, and I think very few people took my pain seriously. Except I think for my dad, which I appreciate. But also after diagnosis, it's been a very frustrating journey managing the symptoms, but also career-wise. I'm a chef, and I remember my first job. I missed work because I was admitted at Aga Khan for like a week, actually after my first surgery. And I remember going back to work and the chef telling to my face, this career is not for the sick. I've had days I'll go to work and then I can't finish the shift. I have to go back home. It's a pain I feel. The people are not seeing it. You know, when someone has, I don't know, other diseases, you can see the symptoms. So for us, sometimes it's a pain only you can tell. So yeah, it's been a really frustrating journey. Yeah, I guess that's what I feel most of the time. I'm generally a happy person. Smile a lot through it, but deep down, it gets really frustrating.
Even through your crying, you're a beautiful, brave chef that you are. Okay? You will do this, you will fight it, and you will be an incredible chef, which you already are. All right? And thank you for sharing that. I told you this is going to surface emotions that we don't know, that we have bottled up, and this is why this session was very important to do. You know, we think it's just one word, but that one word brings up emotions that are very, like I'm freezing right now, not because of the air conditioning, but because of the goosebumps that my body has with the emotions that all of you, we all are feeling them. You know, we all resonate with them. So thank you. And you're in the right place. The whole thing of this journey and the reason why we do this is also because we need to make sure we go to the right doctors for the right treatment. Okay? This is not just about managing, because it's a bloody invisible illness, as you've just explained, right? But with the right with the right treatment plan, through the right doctors who are knowledgeable about endometriosis and who are patient-centered, this is where this journey makes a difference. We don't want you girls going through what we have gone through for over 30 years. Okay? And you're there, and I'm proud of you, so well done. And thank you. And look, how have you said it? Yes, I'm cold. And you're a chef. That's what you are. Okay? For the newcomers who have come in, the exercise that we were doing was just basically writing down one word that endometriosis has made you feel. It's a journey about endometriosis, so just jot down a word that you can describe endo. It could be emotion, it could be a challenge, it could be a feeling. Just jot it down and we'll get back to you, okay? Next, I'll come back to you. Okay.
Hi, my name is Waithera. My word was overwhelming because it is an overwhelming journey. Most of the time you find like you're in this journey alone. Like going to hospital visits, you can't always be having someone with you. So you're alone there waiting to see the doctor, getting diagnoses. For me, it took over like 15 years before I came to know of the word endometriosis. It was always pain periods ni kawaida. Just take Brufen, just take it. I never knew what it was. Then coming to learn about endometriosis, then later being diagnosed also with adenomyosis, it gets really, really tiring. And the fact that there are other symptoms that people don't talk about beside pain. There's that when you wake up and you have zero energy, you're so lethargic, you can't, and you still have to do life. You're so tired, you have to be, you're here, you're surviving with endo, you have to be the teacher to other people so that they can understand. You have to support your own family as a woman as you are. It's really overwhelming. Yes, and you have to be the one who's teaching others, yet you're the one who's surviving, yet you're in pain and you still have to do life. It's really, really, really tiring. And then there's different medications. Today you're on this hormone therapy, tomorrow you're trying this, tomorrow you're trying this. It's too much.
It is. I'm going to put in one word. It's shit.
Exactly.
It's not too much, it's shit. You know, seriously it is, because I get it. Like even, you know, and this is what I say, I've said to my friends as well. that just going to the bathroom, having a normal bowel movement, whatever normal is to us, is a bloody pain in the backside.
Yes.
You know, it is so difficult. Showering is so difficult, but people won't understand it. And yet you have to provide for your damn family.
Yes.
Sorry, I didn't mean damn in a bad way. I'm sorry. I need to watch myself. I'm on we're on TV. Ooh, I mean, as in live YouTube. Sorry. Sorry, everybody. Okay, but thank you. Next.
Hi, everybody.
Just talk a bit louder, because the mic is actually for the... No, it's on, but it's for the online community to hear. So for us, we just have to be a bit more louder and vocal.
Thank you so much. I'm Agnes, and a pastor at the matter. And I've just written pathetic.
Pathetic. That's absolutely fine.
Allow me to pass.
No. Take your time. Take your time and just allow your emotions to surface. Allow them. It's okay. I don't want you to pass it on, because this is why I want you to talk about, express them, even if it's breathing deeply. It's okay.
Well, I've said pathetic because it's been a long journey, 33 years of suffering, and at long last, driving me to early menopause at the same time. But let me say for the better. For the better. And it's a journey that I would say started long before I even entered menses. I started menses. Something that made my mom run up and down when I was 8 years old. Ran up and down with me, looking for solution in the hospitals. And I remember one doctor told my mom that, well, she's in pain, yes, but she's not going to die soon. And okay, said, okay, fine. And all of my family members, my sisters, my brother, we nicknamed that doctor Sitakufa.
Bless. It's not funny, but it's
But he just prescribed some painkillers. We went back home. Then when the next time when my mom wanted to take me there, I said, no, mimi siendi kwa daktari ya Sitakufa. And through the journey, one thing that I can say, I've walked in many hospitals. My dad, my mom were both by my side. And my dad is late, but one thing he said to me before he died is that I pray that you get solution so that you can enjoy life.
Amen.
And I thank God because his words made me stronger. At least I felt there was someone who feels me, even if they don't feel the pain that I'm feeling. I could not prescribe the pain. I could not describe it. But it was just a painful season, not because of periods first, because it started long before periods. And now when I was getting into my periods, wow, it was hell on earth. It was my desire to become a pastor long when I was young. But as days went by, I was looking at myself and asking myself, how would I become when I am like this? Then my dad told me, whatever you desire, you can. I've been putting smile, not a fake smile, and that has always been my strength. I would say God has taught me to smile even through hell. And people have not been relating with what I'm going through, walking up and down. Sometimes even my feet shake because of the pain. When I got married, my dad told my husband, the one you are getting married to, this is how she is. Are you still going to live with her? And he said, I will try my best. Just tell me how to live with her. And my dad told him, you will have to learn to live with her because I don't know how to tell you to live with her. And why? Because it was not all about period for me. 2 weeks before periods, I will be having hell on earth. 2 weeks after periods, I will still be having hell on earth. So my life, I would say, all through, I've been living in pain, but trying to live strong in it, trying painkillers over the counter. And there is a medicine that I've lived long with, is having, what do we call it now? It is going. Yeah, but I've been living on medicine throughout, until one time I said, this medicine might be increasing what I'm going through, probably, I don't know. But then I don't know how to live without it again. Because I've tried every other, nothing works for me. They tried injection, nothing works for me. My husband has been there with hot water bottle. But it's like, I just wanted to be there all through. So I would say that even to my husband, it's not been an easy journey. It's never been an easy journey. And I even said to myself, why did I even get married? If I say that if you are married, you understand. Because it was even difficult for me fulfilling the marital duties. So I was asking myself, I'm making my husband suffer. And if there is one thing that my husband has always been saying, if there is places he has gone so much, is the hospitals. The hospital doors. If anyone would come and ask me, I feel like 1, 2, 3, 4, do you know any hospital that I can go? I can tell you can try this and this and this. But 2021, I was diagnosed with adenomyosis. Then we discussed with my gyna. And before that, I had already, I hated doctors, by the way. From 2015, I hated doctors. I conceived in 2012, but miscarried 2 weeks later. And one thing that made me hate doctors or hate hospitals at that time now was because after that, when you go to the hospital, you start explaining. No one is listening. They start prescribing. Before even you are finished, they are finished with what they are prescribing, giving you the paper. One time I said, I'm not even going to take that prescription to pharmacy or somewhere. So I just went over the counter and took it out. So 2021, it was too much for me. I went back to the hospital, and then I was diagnosed with adenomyosis, talked with the doctor, and he told me now the only way out for this, you will have to part with your womb. I said, this is not a decision that I can make immediately or alone, so give me time. I discussed it with my husband. Then I went discussed with my husband. We went together to the gyna again. He said the same thing. We said, okay, give us time to think over it. 2012, I could not take in the pain. I went to the hospital, admitted, and I was still not ready for that surgery. Then 2024, that was last year, March, I went back to the hospital, another hospital. Then I was diagnosed with fibroids, and they said it's 14 centimeters. I need immediate surgery and such. Then after that, the doctor who came to do this surgery Dr. Yusuf. I say Dr. Yusuf, and I say that with a lot of respect to him. He came, did the surgery. And when I was out of theater, when I came back to my senses, one thing I asked, my husband was there with my sister. I just asked them, where is the thing that was removed? I want to see it.
Yeah.
And they were like, we were not given anything. And I was, no, I need to see what was removed, because how is it that I was in theater and I don't see anything? And then I sent my sister, can you go and call whoever, whether it's a nurse or the doctor who did it, and I want to see whatever was removed. When she came back with the nurse, and nurse said, have you not seen the doctor? I said, no. Okay, the doctor will come and explain. She went and called the doctor who admitted me, not the one who did the surgery. And the doctor who admitted me came and asked the same question. You have not seen your doctor? I said, no. Your surgeon, no. Okay, he will be coming. I think he has gone for prayers, then he'll be coming and he will explain. And I was like, what is it that is so hard? What is it that need to be explained? What I need is just to see what was removed, and that's it.
Yeah.
Then the doctor came at around 8 p.m., talked with me, and told me that it's true. We've done the surgery, but I did not do anything. Whatever I found, I could not do anything because of adhesions. And to me, it seems you have endo, but I'm going to refer you to where you will seek help. So I'm sorry that we had to do this. I was just following the scan, but I did not do anything. I couldn't do anything. Then we talked for some time, and he's the one who referred me to Third Park. And he told me we have many gynecologists. But believe you me, in Kenya, we only have 2 gynas who can deal with this. So please don't give any other gyna to do anything on you unless you seek help from those 2, and you'll have to go to the Endo Center in Nairobi Third Park Hospital. So he's the one who referred me, and I said, if he has given me that, then I will go. That was March last year. So after some time, I came to the hospital. I was well received. Felista received me so well. I appreciated it. And I saw the doctor. We discussed much. I had the scan done and confirmed endo. And so I was supposed to go for the surgery. The amount, I did not have money. As I've said, I've walked around and I was kind of down at that moment. But I tried, and I thank all those who came through for me, who stood with me for that season until I got the surgery in June 26th. And that is now 9 months down the line.
Amazing.
So I would say that even though I had to undergo that and part with the better part of me as a woman, one thing is that I'm free from pain.
Amen.
I'm free from pain.
Amen. Well done.
And
Can I please just say thank you for sharing your story?
Yes, please.
Nothing is a better part or a worse part of us. We as a woman or as a man, we on our wholesome self are amazing.
Thank you.
Okay? And the fact that you had to part with your uterus, yes, I understand. And this is what we were talking about just before we started. I did a hysterectomy a few months ago. This early menopause, induced menopause at our ages, I'm 45. I mean, I've not had children. I wanted to have it, but this is the thing that it comes with. It comes with grief. It's a bittersweet surgery. So also walking through the grief part of it is very, very important. Because once you go through that grief of having it, you come out that obviously the balance, the seesaw for, the pain levels and everything is no longer there. And this is why you're a living example of why we say medication and hormonal injections and all of that is just topical for endometriosis. It's a suppression. It is not a treatment. It's not a long-term treatment. Yes, doctors have to put certain patients on that before they're ready to do a surgery, but when your doctor tells you that you're ready for surgery, the doctor knows. So listen, but also the doctor that you go to, make sure that doctor is an endometriosis and an adenomyosis specialist, so that you don't have to go lying in, your recovery room thinking, where the hell are my organs? You know what I came in for? Because it's all costly. Forget costly, it's also emotionally so draining. Like, look at your journey. Had we had these doctors back 30 years ago, or 20 years ago, 15 years ago, our lives would be so different. But well done, and thank you for sharing your journey.
Thank you so much.
Thank you. Okay, we are limited with my slot, right? Because then, listen, you guys are going to have Q&A with the doctor as well, and you might as well make the most of that session. But I really want everyone to discuss every emotion because it's very, very important. Okay, so let's just, tell me.
Janet Mokenyi Mote, coming from Loitoktok border. So I've used a lot of...
Thank you. Amazing. Thank you.
I've used a lot of herbs. The word I have written here is challenge, or niweke kwa Kiswahili kidogo jitu.
Ni sawa.
Jitu. Maana ni jambo ambalo alieleweki. Tuseme tangu nianze kupata hedhi, mimi maisha yangu imekuwa tu ngumu na ngumu na ngumu. So it has been so difficult, and it's a challenge. It's a real challenge. Simply because where I come from, just come from the village. Nobody understands these things. And if they understand, when you go to a doctor, the doctor tells you this is just very normal. Opening up also even to the parents, to the community, is a big thing. So finding someone to talk to and explain to that person, the best friend you find is the doctor. When you explain to the doctor tells you everything is okay. Maybe, let me say, yani unatibua ugonjwa ambao sio huo. Unapata, most of the time myself, mimi nilikuwa naganda upande wa kulia, kushoto, the left side. My left side has been a problem, from the head to the toe. Sleeping, doing anything, it has been a challenge. So I will say the person who understood me better, it's my dad. So I had to talk to him and told him this and this is what is happening. So taking me through the journey, it became a little bit difficult. Being a father, he doesn't understand what I was going through. The pain was so bad. To an extent, he had to look for the herbalists. So I've gone through the herbs for a very long time. When I came to town, because I'm based in Kitengela at the moment, I've seen several gynas. Switching from one gyna to the other, no solution. The pain is still the same. The problem is still the same. You are being misdiagnosed with a different case. So you go to these painkillers, you are being prescribed to these drugs, nothing is happening. I will say one day I was coming from Kenyatta, the Doctor's Plaza, around Bellevue. That's where I found the billboard of endometriosis. So I tried to tell the driver to slow the mat. He said, "What's wrong with you, young lady?" I told him I want to pick something here. But the makanga was not getting what I wanted to do. So even the passengers, they told me, "Now, why do you want us to stop?" I just insisted. I told them, "I'm coming from the hospital. I'm not feeling fine. Give me, even if it's 5 minutes," because we had already passed the billboard. I tried to come back. Dogo, I took the contact and what have you, and then I went into the bus and the journey continued. That's where after getting the contact and what have you, I realized there was this endometriosis and what have you, sender, you can get help. I think, thank you so much, Doris. Because after joining the group, I found I have fellow sisters who we can share my problem, people who can understand me while I'm in pain. I found that I was not alone. We are many, we are suffering, we are so many. Because outside there, somebody sees like every day you are sick, you are faking, you are diseased. They don't understand what you are going through. Because from first to that year, you are in pain. Myself, my journey has been so painful. Me, there is no any day, single day I've gone without pain. Every day, even working, it has become a problem. And I have a 9 years daughter. She has really helped me in managing my pain. In those water bottles, the plastic, whatever she will get. She will just put hot water and come and place it in my tummy and tell me, Mom, it's going to be okay. She cover me up, use some oil, massages. I thank God for her. All in all, God has been faithful. I've had an embracing family on my side. I say thank you, and thank you for the Endo sisters. We are fighters and we are more than conquerors.
And thank you, because you know that saying that on every International Women's Day where we post that we're strong women, may we raise them, may we be them, and what is the other? There's a third part of it. You are one of them, and you're raising a brave, strong woman as well. Yes. So thank you.
Yes. Hi everyone. Is that loud? Is that loud enough?
Yes. Thank you.
So, well, my name is Nyakio. The word I wrote was tumultuous.
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 So just it's been 20 what years? 27. I always have to calculate with where we are then plus 2. It's been 27 years of pain every day. Increasingly worse. Amazingly. Sometimes I'm amazed at how bad it is. I've taken the painkillers. I have the hot water bottle. I want another one for my back right now. You've done everything and you're just like, wow, this is so bad. Hi, Brio. Sorry, so I know him because I'm in the music industry. He's a drummer. I'm a drums teacher.
Nice.
And I'm a freelancer. If I miss lessons, I don't get paid. If I miss lessons often, the directors of the music department move on to someone else.
Of course.
There's a parent who asked me, why can't you just get another teacher to take your place when you're not able to come? And I'm like, I don't know when I'm not able to come.
Exactly.
Because I wake up and I can't move from the bed, I had surgery. Well, I've had other issues, hyperplasia, the fibroids, polyps, so I've had surgery for that. Initially, they thought that's the issue. Then I was told endometriosis, and I went into depression nicely. Why? Because I knew there's no cure, and I thought that the hyperplasia was the issue and there's a cure, yeah? This is my sister. I've seen her struggles. She might look younger than me, but she's older than you. She might be the oldest in the room. So I've seen her struggle. I grew up seeing her being taken to hospital. So I minimized my own pain because I'm not being taken to hospital, but I'm blacking out on the streets of Nairobi. Sometimes by myself. Thank God I was not robbed or, And I had surgery and I expected no pain when I woke up. Unfortunately, that has not been the case. There are other issues like fibromyalgia and chronic pelvic pain. So again, I thought having I was diagnosed with adenomyosis also, so I had a hysterectomy and the fallopian tubes were removed and cervix. I thought that's going to be the solution. I'll be able to like get back, because I could feel what everyone is talking about their careers. I could feel, I can see concerts come up and people I've taught are the ones being called to play.
It's hurtful.
That to me is like, oh, Nyake is not reliable anymore, because we'll call her and then the morning of she'll be like, and Aki, by the time I've called and said I can't come, I can't move. The disappointment of still being in pain after the surgery has been so difficult, and on my mental health as well. I had been diagnosed with anxiety and depression, and then in October I was diagnosed with cyclothymia, which is bipolar 3. And now taking medication for that. I have severe IBS from when I was a child. Take medication for that, and then suddenly you have your diarrhea is not stopping. I've been diarrheaing since October. I was 80 kgs and now I'm 64 kgs. It's just, it compounds and compounds and compounds, and you're just like at a loss. Yeah. But I've noticed everyone has said something positive despite all they've gone through, and I want to say that my sister has been my rock. To be honest, I have considered suicide several times. I have gone to the extent of choosing which way. And she's the one who held me up, especially after the diagnosis. I got the diagnosis in 2018. The whole of 2019, if it's not for her, I honestly would not be here. For sure. And I mean, she deals with her own, she has fibromyalgia, endometriosis, sorry, I'm saying them for you, adenomyosis, she has her own shit to deal with, but she has been my rock. She came to live with me, and we've been living together and holding each other up. And so I'm really grateful for that. I'm grateful for Doris, for Arti, for Jambi. Jambi burst the gates of society so that they had that endometriosis is there. So when we speak now, like laymen, I tell them endometriosis and they're like, huh? Like the security guards of the schools I'm going to. Then I'm like, unakumbuka ule mras. Then they're like, oh, ayaya, aki madam pole. Like if there's anything heavy to lift, I teach drums, everything is heavy. They help me. But she kicked down the gates, and I'm so grateful for that. And for such forums, and for the doctors, and like you said, for the generations that are coming, they don't have to suffer as much as we have. That is progress. Yeah.
You are progress.
Thank you.
Not that. You are progress.
Thank you.
You sat there saying that you've listened to everyone saying something positive, whilst you didn't realize, whilst you were talking about pain, you spoke about pain with a smile.
Oh.
If that is not positive, and you sitting there going through all of this, when I was 15, I tried committing suicide. I've gone through depression, but at that time, I did not know that the part of depression, what I thought was all of it, was there was a demon inside me culminating by the name of endometriosis.
Yeah.
So we had no idea. I used to blame everything on endo.
Yes.
Every single damn thing. Yes. You know, and the thing is, the severity of endometriosis and adenomyosis, especially endometriosis, and this is why we need to, like, for your example, we need to look at it. It is not a reproductive condition.
Yeah.
It is outside,
Yeah.
you know, and the tag-alongs that it comes with, the other illnesses that it comes with,
So many.
or is induced from it, or worsens the existing co-ones, it's a nightmare. You know, and obviously we do need the government support. We do need this being educated in a wholesome, in an entire entity that it is, that covers the mental, the social, the physical, the financial, family supportive, every single element of it.
Yes.
And I'm so proud of you, and you're very lucky to have your sister support, everyone in this room, you know. And let me tell you something, for individuals who don't even have that support, never ever forget that you yourself are your support, no matter what. Okay, because not everyone is lucky to have that support. Not everyone is lucky to, you know, and not every, I mean, I'm not putting luck together with this dreadful journey. But I wanted, and please, like, I mean, if you ever wanted to, I mean, you know how we all are. Come on, we're all there. Okay? I will tell you later as well, but as we move on, because we're limited with time, but Doc will just have to be. Okay? Talking about Doc, and he's just walked in. Oops! Hi, Doc! So, you know, there are support groups. Hi, Doc. We're having a very emotional session. Tears are rolling. Obviously, a hand for Dr. Yamal, please. Are you okay? Yeah, you. Thank you. Hi, everybody. Hi. But thank you. And remember, it's okay. Feel your emotions, let them out. It's all right. It's a safe space.
Hi, everyone. My name is Rose.
Speak louder.
I don't. Maybe I should stand. I don't know how to
That's
be
okay.
loud.
However you feel.
Hi again. Hi. My name is Rose. I'm Nyakeo's sister. There's a 12-year difference between us.
Wow. Wow.
This is my 40th year dealing with endometriosis and adenomyosis. Along the way, fibroids checked into the equation. I had surgery for those. And because of managing the three conditions, as we know, they are all very painful, so you end up being given a lot of very strong medication for pain. You end up having getting anemic, so you're given medication for that. You have to be, during our time, we were put on horrendous hormonal treatments, which now you have to have calcium and bone supplements for. All those three medications have very severe effects on your gastric system. And for me, that ended up in two other diagnoses. It's called, Dr. can say it's an iatrogenic condition now. I have IBS because of that, and reflux disease. And because of my body being in chronic pain for so many years, now I have a diagnosis of fibromyalgia. I am grateful, however, that for the last 7 years, medical menopause has worked for me. I do not have periods, so I no longer, my periods are debilitating. People ask on a scale of 1 to 10, what was your pain? I'm like, I don't know, 1 to 10. I think I started at 300
6,000,
and ended up at 1,000. And this started right when the period started. I'm doing much better, like I said, when it comes to the endometriosis and adenomyosis, because the medical menopause works, but it does come with its own side effects. It's worsened the fibromyalgia. I'm on the autistic spectrum. It's worsened that. I get meltdowns very easily when I'm stressed.
It's okay. You're doing amazing.
Thank you. So my word was depleted.
Your word was?
Depleted.
Pardon? Depleted, yep.
Yes. In all of this, we have, our mom was diagnosed with dementia in 2023. So it's been it's been so hard, but I'm so grateful for this place, because when my sister's medical regimen didn't work like it did for me, I had been doing research. I was diagnosed late after 33 years in 2018, believe it or not, because they had diagnosed their adenomyosis earlier on in the 90s, which was rare, and so that's what they were focusing on. But in 2018, I was like, there's something not quite right. So I followed the advice of the medics abroad, and that's how I got my diagnosis. And my sister's complications worsened, and her, like I said, the medical route didn't work for her. So as I kept researching, and I found this place in, I think it was October 2023, they were on television. And so we came and we saw Dr. Yamal. And to my shock and surprise, he said my sister had severe adenomyosis. Nobody had picked that up, and recommended surgery. So she had surgery in July last year. And even this support, we didn't have this. Doris and Arti have said, we didn't have this support. I mean, I thought I had a rare disease when I was told I had adenomyosis. I don't know who. I was diagnosed in 1998. I met another person with adenomyosis in 2015 when I joined the Endometriosis Foundation of Kenya. There were like 3 of us over there, you know. So I much as it's been depleting for me, I shall continue to be strong for my sister and for you guys also, just to know that even if we have to do life hard, we can do life. That's one thing I always say. On my socials, I say that I navigate life chronically exhausted, which is the truth, because right now fibromyalgia is really kicking my ass, excuse my French. But you live life in spite. It might mean taking life a different route, you know, sitting down when other people stand, having fewer lessons than you could have, calling Brian to substitute because you can't play for the gig, but you do life in spite. And that is what I will die on that hill, because we are here to live, and even if our journeys are so hard, we can live in spite. And I'm so grateful that my sister dragged me here. Because I was like, I'm not waking up. But because this forum is so useful, that we work together and we support each other. Our journeys were really hard 30 years ago. Like I said, you don't even, people are looking at you like, at periods.
It's like Endo.
Wow. You know, yeah. But now there's information, there's this center that can help, even if you might not be 100% pain free. You're relieved of the disease is no longer in your body, you know, so you can take baby steps and walk and live. That is what I say. We have to live. Even if it's hard, we have to live. And I'm so grateful for being here and for meeting all of you guys. Thank you.
Thank you. You know, just give it to her. You know, you said that fibromyalgia is kicking your ass. I'm sorry. You are kicking all their asses. You are the one. Sorry for saying that and sorry for using that word, but this is what it is. And you know, and this is the thing that a lot of people forget, that mental health is also, all these different mental health illnesses are sometimes hereditary, genetic. And you know, when they come in that form, together with, you know, as we said, endo, adeno, all of that, enhance everything. You know, so let me tell you, you ladies and men, obviously, who are supporting, everyone here, you guys are incredible. You are fighting this damn thing, and you're smiling with incredible, oh, yes, we have little babies and children here. But you're doing incredible. You're amazing, and never doubt, even in your lowest days, your lowest minutes, you are incredible. All right? Each and every one of you. Everyone who shared their word, and based on that word, the journey, let's keep it now with the word. I know you want to share your journey, and it's fine, share it, because let the emotions come out, but I want you to emphasize on that word, because that word is what's letting all this come out. Right? So thank you. We'll do one more, and then we'll take a break, because so basically for all the newcomers that have come in, what we've been doing is I've said to write one word that endometriosis, the journey for endometriosis has made you feel. It can be an emotion, a challenge, or a feeling. So I want you to write it down, and then we've been going around talking about it and seeing what that emotion is. And through that, the ones who have already gone through, and also the ones who haven't, have been feeling it. I've been feeling every single word that's here. Emotions are being let out. But I don't want to take so much of Doc's time, because he's here for his Q&A as well. And you guys get a private one-to-one with him. Well, right now in a group session. So we'll do one last one, and then we'll hand it over to Doc. Once he's done, we'll continue this exercise. There were other stuff that I wanted to do, but right now this is way more important. After that, we will do one small breathing technique that we will go through, which will help you even in your times of overwhelm, depletion, fear, scared. Every word, it will just ground you a bit and give you that 1 minute of strength that lasts a long time. Okay, so thank you. Give me your word.
Hi, my name is Brenda, and my word is loss.
Her word is lost.
Loss.
Oh, loss.
Yes.
And loss. Yeah, lost. Absolutely.
It's a very broad word in the sense that I've lost big opportunities, like really big opportunities that would have been life-changing, and also some very mundane things, like not wearing my heels because of my back. I know it sounds trivial, but I love my shoes, guys. So, in the loss also not for myself, but for my parents. I know a lot of you, or a lot of us, come from communities where having children is, I think, one of the things that is expected of you. And while I had made peace with it from 14, 15, I knew I did not want to be a parent, but my parents always wanted grandkids, and they were like, oh, you'll change your mind and everything. And then when I had my first surgery, they took out my tubes, and I thought, oh, great, we have like some leeway, we can play around with getting kids through IVF, even though it wasn't something I wanted. And then moved back home because I couldn't take care of myself, so I lost my community, I lost a lot of my friends. I was supposed to start my PhD, and then when you can't take care of yourself and you're in a foreign country, it becomes a challenge. So I had to move back, and it was really hard, like moving back and adjusting, and then coming from a place where endometriosis is talked about, and there's even legislation where if you miss work, it's not that big of a deal, to a place where everyone looks at you like you're crazy, and you can't really miss work, your normal activities, things that I would do now I don't do, to then now trying to find a place that understood what I was going through and the other related conditions I felt that loss, especially in terms of healthcare as well. When you come from a place where your healthcare is, everything is top tier, and you come back and you're like, where? The absolute ghetto, if all of you can understand that. And then to now finding this place. Oh, she's my cousin, so she's been with me through this. To finding this place and to getting Dr. Morioki, who
from day one was like, you know what, you're not crazy. I understand the loss and all that. But I think it's how people downplay your loss. Like a lot of people will be like, oh, but you can do your PhD at any other time and everything. And I'm like, no, it's not the same because I was set on that particular institution. Getting back to that institution is really hard. And then now to all the other things of having your choice taken away. Like, while I was sure I didn't want to have kids, when I did my hysterectomy a month ago, the choice was completely taken away. And I don't think people understand that having that choice of not wanting to it becoming, oh wait, now you can't do it. I don't think people understand that impact, because everyone's like, oh, well, but you never wanted kids in the first place. And I think the thing that has also been really big is losing my community and my closest friends, because of, again, having been forced to move back in a rush. Like, my move back was very chaotic. You're sick, you're not eating. I'd lost weight, I was 40-something kgs. I was looking very, it was not pretty. And my friends understood this. When we'd plan our activities and everything, they'd factor that in to coming back and then starting to build new relationships, explaining from scratch again, this is this, I can't do this because of this. That loss has probably been the biggest. So yes, loss was the word, and I believe most people can relate to that word.
Absolutely. Thank you. Thank you for sharing loss. Yeah, loss is one word that obviously resonates with each and every one of us sitting in this room, because obviously we have all had to sacrifice a lot of our dreams since we were young, aspirations, goals, work. It's all been stripped off us, you know, and unfortunately, this journey has been unfair, but I'm trying to, like, from my own personal journey, just to live what we now have to live with, we have to take that responsibility, and it's hard. It's not easy. I mean, I'm standing here talking to you guys. I have my own really bad days. I have my low days, but those low days are okay as well. But this is the thing, it's flipping that negative thought into not a positive. And I'm not saying we have to be positive, because positive thoughts, positive people are not who don't have negative thoughts. They do have negative thoughts, but they use it as fuel to channel strength within you. And I'm saying within you, because everything we're feeling and going through is coming from within us. You know, supposed to having a pity party for ourselves. I'm sorry to use the word pity party, because unfortunately, in this journey, if we don't beat it, if we don't try and win this, unfortunately, there's no room for pittiness, because everybody else looks at us with pity eyes. You know, because they don't understand, most of them don't understand it. So why are we taking that word and putting it in us? We're not pitiful. We are strong. It's hard. It is hard as hell, but we are strong in that hard. Yeah? And we're worthy. We're worthy of everything, including whatever we have lost, we're regaining. We're worthy of that gain. That gain may not be where we wanted it to be and may not be what we wanted, but we're there. You will be cooking in your kitchen if you're the chef. Even if you're cooking and you start a little thing, that is a gain. You know, you're drumming. You'll be drumming. You come and we will all be there. You do an Endo event and we'll all be there. You know, you'll be doing whatever you're doing. We're all, like, the support is there. And you know what? I love these smiles. And I love seeing the smiles from the men as well, because this support is amazing. You know? And all of you, I am so incredibly proud of each and every one of you. And thank you for sharing for now. And then I'm going to pass it over. Otherwise, I'll continue this. And Dr. Yamal will be like, okay, where's my turn now? Sorry.
Good. Let's clap for Arti. Hey, some icebreaker. Emotional change. Let's all stand. Give someone a hug. Tell them you love them. You're in the right space. Give someone a hug. At least 5 people. I said 5. I said 5 people. I said 5.
Really good.
Yeah, at least I can see the smiles. They are back. Nice. Let's take our seats. We will have that moment sometime later. After all this. Oops. So we will have that moment sometime later. It's good to share that hug. I know everyone has felt nice, right? You are feeling alone in your space, but now you felt nice, huh? So I will go off the program because we've shared our experience and not everyone has shared. We will try as much as possible to catch up from where we've left. But allow me to introduce the next guest speaker. His name is Dr. Yamal Patel. He's a consultant obstetrician and a gynecologist. He's the director of Third Park Hospital, the space where we are sitting. He's a trustee in laparoscopy Mashinani. He's a member of American Association of Gynecologists, Laparoscopy, AAGL, a lecturer at Aga Khan University, associate member of Royal College of Obstetricians and Gynecologists, immediate past chairman of cases, past executive member of ISGE. ISGE, right. So Dr. Yamal has taught us to be this strong. That is why we are not emotional, because every patient is special to us. And us at Third Park, we care. Karibu sana, Dr. Yamal.
Thank you everybody. And really, I'm impressed seeing all of you here. It's been my dream for over 15 years that's materializing to this now. Yes, I've had my own personal stories as to why I went into endometriosis care, and very close people to me have been affected. And then I said, no, enough is enough. I need to do what I best can do. This is my journey of getting into obs and gynae, and especially now diverting towards endometriosis care. And this is something that you all know is not an easy field to deal with. So there are not many endometriosis specialists in the world. Forget about Kenya, forget about Africa, in the world. I can tell you for a fact, they are in hundreds in the whole world. So this is the problem. So I am not here to give a talk. I was given a program, and the program was that I think after Arti has had a session with you, and it was really emotional, I agree, but that brings out the strength in you. I am a fighter. I never give up. Whether it's for myself, my family, or for my patients. I mean it. Those of you who have had that experience with me, you'll see it. I do not give up. I'll give you my best, and I'll take you out of your sorrows as much as I can do it. So it was really nice. This is what I envision endometriosis care to be in this country and in this region. We have been working hard in training people around Africa in endometriosis care for diagnosis. If we get the diagnosis right, things start following through, all right? We've been doing school visits. We're going to schools and workplaces and corporate places and giving talks. We've been giving talks this last 2 weeks. We've given talks to insurance companies, Those of you who have insurances, you'll realize when you come and bring up the word endometriosis, they back out. They're like, you see, this one, let me not take it, because they know it's difficult and they know it's going to be an expensive affair. But it is. And therefore, we need to sensitize them that, guys, this is real. You don't have to back out. Understand it. If it means that you want to take an additional premium to say, we'll cover your endometriosis, pay this much extra per year, I believe there are people who will do that. But you can't back out and say now, oh, endometriosis exclusion. How? I mean, you did not select it. You got it. Now you need help. So if they back out, what happens? There are those people who now cannot afford care. So what happens? They either don't get care or they get care in places that don't give them the right care. So it's surgery after treatment, after surgery, after treatment, after surgery with no improvement. Doesn't help either. So I think we've been sensitizing insurance companies, we've been sensitizing girls and schools, we've been sensitizing workplace and workmates and tell them, listen guys, be sensitive, don't stigmatize, empathize, all right? You see a woman and the next thing is you gather together and make fun and yeah, next week, this woman, you'll see she'll not be here 2 days. I mean, as though it's her wish to do that. So I think that is important. And this is where it all begins, where you people sit together, come, discuss, share stories, all right? And you will realize you come out and walk out of this door stronger than you came in today. So that's all we want. I think my session was supposed to be covering any basic question and answers that you may have. Remember, it's not exactly meant to be a clinical session. We are not discussing full treatments. But yes, if you have any specific questions, please feel free to ask. And I'll try and see how I best can answer those questions. Yes, please. So I know it's not ringing, but it's going into that.
Okay. Again, I'm Doreen. I'm asking about, I've seen Doris recommend you. But also, I've seen Doris recommend you in groups. But also, the reason why personally I've not gone to other doctors is because I've felt like their time is limited, especially to go through your symptoms and questions. So my question to you would be, if I wanted to consult and possibly tag, for example, my dad along, do you have like a minimum, this is a minimum time of consultation in the consultation room, and then after that, next patient? Or are you as a doctor open to taking time with a patient, which mostly I don't
That's
see?
not a question to me, all right? Ask the patients who are here. Yes. All right, so it's not, because you see, if you ask me, I'll tell you what you want to hear. And if you ask my patients, they'll tell you what is facts. No, but you've understood my point.
I was asking because I've seen in platform written you have 15 minutes. In the site where you're booking a doctor, you have 30 minutes.
Exactly,
That's
so
what I
they're
was
here.
asking.
Please ask.
I've seen Dr. Yamal, and he gave us a whole day. A whole day. We saw him across. We spent like an hour with him. And then we came back on this, someplace on this floor. Yes. And he took like 2 or 3 hours with us. So in time, I hope nimekujibu.
Yeah, thank you. Any other questions? Doris, yes.
Yes, thank you, Dr. Yamal. I just want to veer just a little bit slightly to adenomyosis, and I just want to maybe just ask, because I'm sure you've seen with the records and the many patients you've had that especially that there's been lots of cases of adenomyosis. Even like myself, I had adenomyosis at the age of 12, and I've had other ladies talk about adenomyosis. And you know, when we go to the literature that's even maybe written there, you see the age most women with adenomyosis are in their later childbearing years, between 35 and 50. These are statistics based on Western people. And we need now the push for these statistics of African women in this continent, that it is coming in much earlier. It is impeding the kind of treatment we can get. Because, when they start saying adenomyosis, it's like, no, you're not yet 40. You've not yet had children and all that. So I think maybe from your research finding, this is actually just like a challenge to you. But from the kind of the people you have seen, the women you have seen, I mean, you're able to have documented that this is happening at a much earlier age. So to maybe help us in pushing the adenomyosis narrative to show that it is happening. This could be in the Western world, but here it's happening at a much earlier age.
So thank you for that, Doris. I have patients even today of 14 years with adenomyosis. So this is what we have known. And what we know now is very different, okay? I have in my office, on my table, a diary called Adenomyosis in Pregnancy. I have over 60 patients currently pregnant with adenomyosis. They go into a separate book for a reason. These are high-risk pregnancies. They do have lots of complications. So getting pregnant is one issue. Staying pregnant is another issue in this women. All right? So when you come into my office and if I've diagnosed you with adenomyosis and you now are helped through to get pregnant, you enter that diary of mine. I'm currently doing a study on that. I'm actually developing guidelines on the protocols that should be used for patients who have adenomyosis and pregnancy. I have been collecting data on the teenage and adolescent adenomyosis patients as well. So you're very right. This is an old narrative. It's very different now. It's not only a disease of the elderly and of the people who have children. It's also seen in women who do not have children, who are also having adenomyosis. So very true and rightly phrased. The issue about data, yes, we are looking into that, but you have to understand that trying a kind of a survey will need more than one clinic to run that, okay? And that's why we are now going to schools and even when we went to the school, I talked to my students and I told them, you've come back. So many girls came up with questions and answers, and I can tell you we now have even prepared an adolescent clinic in my clinic. What we are saying, we'll go to a school, we'll talk to them, we'll give them a code. With that code, for the next 3 months, these girls from this school are allowed to come to my clinic on certain days at a subsidized to no cost to them. And they come and see me, but they have to provide their ID for that school. And we're trying to survey and find out and help these young girls who may not be able to afford. They are in school, they're suffering, come see us, we'll try and help you. So I told them, can we get some data? So the problem is, they said, yeah, we'll look at this, we'll see out of all those who come to see me, how many have adeno, how many have endo. But I said it doesn't work that way because the population should have been then the whole school. So we went to a school that had 650 students. Unless all 650 students are screened, you can't get a proportion. You can't say 50 saw me, 40 had endo. But they came to me because they wanted us. They had a problem. So you see, these kind of things may need additional help. If there are some of you with that background of statistics, feel free to contact me and let's see how we can best do it because we need the local data. All right? Those of you who studied me in medicine, let me tell you, until 15 years ago, you know the saying from some of our professors, there is no endometriosis in Kenya. So when I used to diagnose endometriosis those days, I used to be told, this guy is mad. What do you mean? There is no endometriosis in Kenya. Everything was PID, infection, PID. It's not the endometriosis. And now, let me tell you one more thing. We actually have worse endometriosis than the ones out there. One, they are delayed. Two, like it or not, the tissue in the African woman is much stronger. The collagen is very strong. For those of you who don't, Africans are also at more risk of fibroids, right? The same way, our tissue is that is stronger. So you know when tissue is stronger, you don't see prolapses. The uterus, you have 10 children, 5 children, your uterus doesn't fall down. Go to India, you have 2 children, your uterus is hanging outside. All right? So there are differences in geographic locations and racial differences. You get what I'm saying? Now, because of that, when your tissue is strong, if that tissue gets endo, it's a mess. I'm telling you. When we do our endo marathon every year, we did it last year, we did it the year before, and we are doing it again this year. Endo surgical marathon in October. I get in some of my experts, friends from outside, isn't it? When they come and operate here, they say, Yamal, I don't know how you guys do this. What is this tissue? Because it sticks so much and is very tough that it's very risky. So this is the thing. Not only is it there, but it's very difficult here. It's very advanced here. All right? So we need to change that narrative to pick early and therefore prevent complications. Okay? Thank you. So we'll look at that. Yes.
Okay, thank you, Doc. I'm Agnes. I'm just asking about probably if there should be something like after the surgery and the recovery period when one is getting back to normal lifestyle, there should be something probably to show or to help the patient come through from the aftermath of the repercussions after the surgery, especially, let me take my case, after the hysterectomy. Now there is that aftermath. I thank God because the pelvic pain is off. But now getting back to the normal lifestyle kind of.
Yes.
Bit tight.
So I think what you are trying to allude to, Agnes, is it does not end with surgery. There are many other things that actually need to be done. And that's where comes the question of, or the logic of multidisciplinary. So you know, we are a multidisciplinary center here. And when I say multidisciplinary, we have the expert surgeons, the endosurgeons, we have colorectal surgeons, urologic surgeons, fertility specialists and IVF specialists. We have psychologists, we have counselors, we have physiotherapists, we have specialist nurse, we have pain specialists, they're called pain specialists. This is a whole team. We have gastroenterologists. So this is what we call a multidisciplinary approach. Now, once you're done with the, let's say, the surgical aspect, you may need some of this help to get out. So some of the things might be emotional, all right? You feel the loss. You had loss. You've lost a uterus when you are not supposed to have been losing that uterus, but you did not have much of a choice. How do you get out of that loss? You need somebody to sit down with you and discuss that with you. You have pelvic floor weaknesses. You know, some of those diseases go up to the nerves. And these nerves, when damaged, and they are very, very easy to damage because they can't be seen, and now they are in this mass of endometriosis nodule. If I don't remove this, you will never feel better. I remove this, you damage some of the nerves. It is a balance. Let me tell you, it's a balance, okay? You do that, you can't pee. You can't feel the bladder. You've damaged the nerves that empty the bladder. You get my point? You get chronic constipation as an effect. So you need people to now help you with this physiotherapy, pelvic floor muscles. You get it? So it's supposed to be a continuum of management. You do that, it does not mean it ends there. You need to have, let's say, a follow-up plan. When do we see you next? All right? Does it mean I've ended my story here? No, it shouldn't be. I'll see you next in 6 months. I'll see you in a year. It's very important. Have a checkup. So at least all those patients that I know I've had with endometriosis, I do tell them, even though we are done now, an annual checkup is necessary. And some of them actually bounce back to levels that baffle me. I'm telling you, I have personally my own patients, one who after the surgery where her bowel was resected and anastomosed and everything was cleared and blah, 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 started now 2 years ago, after the surgery, just 2 years ago, started now riding bicycle. And when I say riding a bicycle, I don't mean riding a bicycle. She rides from here to Nyali in Mombasa. She goes to Kisumu. She goes to Turkana on a bicycle. All right? She goes to Rwanda on a bicycle. And I'm like, what has gone into you? She's like, I want to live my life now. I have someone who started climbing mountains. I'm like, now she's busy summiting different mountains everywhere and sending me pictures. All right? I'm like, what's wrong with this woman? But it's like, that means you were tied down and now you just suddenly feel free. All right? I have another one who, I have some weird people. I don't know what they are doing. I have someone who went into dancing and now is doing dancing on stages and doing shows. And this was a woman who could not move during her periods. You get it? So the way we say it, it's all up to you. It's all here. If you want to get beaten, this thing will beat you. If you want to beat it, you can beat it. All right? So it's all up here. You guys go and say, I can do it, and you pin it down. All right? So I have these 3 examples, who actually baffle me as to how much they bounced back. All right? So recovery process, but then very strong mind up. This is another strong person here. She's been through a lot, but she's never given up. Okay? So this is what I meant. Okay, guys? Sawa, any other questions? Yes.
Hi, Daktari. It's not a question. It's kind of related to what Doris was talking about. I will use my part of the journey to explain. So, I was diagnosed with endometriosis from symptomatic, and then put on a lot of stuff. When my sister told me about Third Park, and she's like, no, they're doing let's go and have the transvaginal. And this is, the person who diagnosed me is I don't know the word, like if you say something, I will listen to you. Not expert, but she's a gynecologist. Now you know she's female. She's a gynecologist who's well revered. That's what I was looking for. Okay, so and she's diagnosed me with endometriosis. She's put me on hormonal treatment that did not work. I ended up being on hormonal treatment, 3 different Zoladex, Mirena, Sayana at the same time, and I'm still in so much pain. And when we heard about the transvaginal scan here, and I had done other transvaginal scans, nothing showed. I came and you diagnosed me with severe adenomyosis. You told me it's like glitter, and also the endometriosis was there. I took that report back to her, and she was like, okay, yeah, but let's just keep trying this, and then we'll see whether you need surgery. And I'm like, what do you mean? When I was like this lady here, by the time I was 10, I knew I don't want to be a parent. And I had told her that. I had told her, if it comes to that, I'm okay with it. I know I don't want to be a parent. 18, thought about it again through and knew I don't want to be a parent. Then she says, yes, but let's just keep doing let's just keep trying the hormonal injection, the hormonal treatments. And I'm like, but it's not working. We keep trying this and this and this, and life is just getting worse, So I decided to come back to you. We talked about it. Then charted the way forward. Dr. Njagi did the surgery in July last year. I'd like to say I'm pain-free, but no, still have a lot of pain. Sometimes it is less than what it was before, which makes me realize like that pain was crazy. But my issue was the pathology report. The pathology report said no adenomyosis, no endometriosis. I could not even go back to my gynecologist. Actually, she didn't know I came and had a surgery because of how she wasn't against it, but her energy was not working. So how do I go back to her with that? She's gonna say, see, I told you. So it's a challenge to the pathology department, or I don't know how it works between the two of you. Because if we can see it there in the screen, then you say it's not there.
No, so let me answer that question, and very rightfully placed. You know, the one thing about these conditions is the way you've heard many people say, they've had very many ultrasounds even before. And then you go to an endometriosis specialist and they look at it and say, but here is the problem. And you go back even the next day to another person and he'll be like, no, there is nothing here. So it is like that. This disease is like that. And the same thing happens even in the pathology departments. So what I'm saying is not everybody picks the same things every time. I understand, but it's not us doing the pathology. The pathology goes to a pathology department. So you see, the way we are now, at least I know we at Third Park are now training even sonographers in diagnosing endometriosis and adenomyosis. And the same way we are training people to treat adenomyosis and endometriosis. We are also discussing and teaching all the different areas, including pathology, on what it looks like. Because we have seen, and let me tell you, you're very right. I have a few of my own patients. I can tell you for a guarantee, I removed endo. The report comes back without endo. And the patient asks me, and I tell them, listen, it's fine. I know what I have done. I know what I've seen. And you know, I record my videos. I have the whole record. So I can tell you, this is endo. Whether you like it or not, go anywhere, any part of the world with this video. I'll give you a copy. Go tell them what is this. Those who know endo will say this is endo. Those who know adeno will say this is adeno. Those who don't know will not know. That's the problem. You get my point? That's the problem. Yeah. So it's a bit tricky. It's a bit that's why there is a problem. You get it? That's why there is a problem. And I agree, it brings the patient thinking. Now, let me explain about why the pain sometimes persists. When you have pain in the pelvis that lasts continuous for more than 6 months or 8 months or a year without proper remedy of the cause, not painkillers, you go into what is called sensitization, central sensitization of pain. Central sensitization of pain, when it happens, now even a trigger like a touch is pain, because the sensory organs here will trigger and send out, you know the way I can close my eyes and I do this, I'll say, someone's touched me. When you touch the person with central sensitization, pain. It's not someone's touched me. You get the difference? So when you get central sensitization in the pelvis, you can remove all the pathology, but the nerve endings have been sensitized to pain. So a full bladder, pain. A bowel constipation, pain. A movement from here to here, something touches there, pain. You get it? A small cyst forms, pain. It's not endo, but now it's central sensitization. So that's the problem. And to desensitize that is not that easy. But that's neurological. So if you really have that kind of pain, you can blunt that pain sensation with some neurological blockers. So there are solutions to it, but that is central sensitization. Another thing, when we operate on patients, and I see one of the patients I saw yesterday, whom I told to come here today, all right, to join this forum. Another question that we usually get, we do an extensive endo surgery, remove all the lesions, blah, 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 and even when I scan her later, it looks fine. But this patient is young, wants the uterus preserved. And we preserve it because we have to respect the whatever much possible. And many of them we've even helped now to get their childbearing goals, okay? But that uterus had adenomyosis. You can never remove all the adenomyosis in a uterus. Let me be very clear on that. Okay? We have another example there. Okay? You can't remove the adenomyosis in the uterus. You can only debulk it because it's in the wall. And if I remove all the wall, what will I remain with? I'll remain with a hollow. A uterus is supposed to be a round structure. You can't remove one wall and throw it away. So you can debulk it. So what happens? The endo is gone, but the adeno is there. The pains remain. They may not be as bad as before, but the pains remain, some of the heavy flow remains, and it can again start progressing because of adeno. So they come and ask me, but doc, you removed all the endo, why am I still in pain? It's your adeno. And if I sort that adeno out, you will be fine. The only problem is, the only solution for adeno complete is if that uterus goes. Because when I do small bulk debulking, it's only temporary. So now we are understanding each other. So many times, even after an extensive endo surgery, adeno is still the culprit. You get it? Yes.
Hi.
Hi.
Yeah, so my name is Janice. I wanted to touch on a few things. One is you mentioned something to do with, kind of going to high schools, talking to students and creating all this awareness. I think one of the things, when I got diagnosed, one of the things I was asking my guy now was like, how come why was this not like caught sooner? And so like with regards to the whole having a statistics background, to be honest, I would want to volunteer for that because it's something I would want to kind of push for. Because I know there's a lot of, especially like in younger ages and the way how much pain is normalized. I've had a lot of people talk about like their dads being supportive, and I'm like, that's how much our moms are used to pain. Like they for them is just like, you will get through this. I gave birth to you, so you will get through this. So I would want to volunteer for that. That's one of the things that I wanted to say. And kind of at least figure out how we could be able to push for more of this.
Yes, and those who have contact with schools, let us know. If you have contact with schools, if there's a school that is willing to invite some of us to go and talk, we're willing to, right? We'll just have to put it in a schedule and say, we'll have to put it in a schedule and say how to go and talk to the school, right? But we are really, really keen in doing this because, you see, work aside, that is service to society.
Yes.
It's very important.
Yeah.
Okay?
So
and the earlier, the better.
Yeah. Then the other thing that I wanted now to talk about, or rather to kind of now ask, is more in line with treatment. So one of my questions is around surgery. I think I've seen one of the ladies in the group who mentioned that she actually had a hysterectomy, but now she still has like adhesions growing, and she's wondering, like she's done like 3 surgeries, and now she's even tired of the surgeries. If there's like a way to get rid of those without having to go back to surgery again. And to be honest, my fear around surgery has also been around the same thing now, because I'm like, okay, what if this thing keeps coming back? So I'm also asking, like in terms of management after surgery, or even during the process, right? What are the other things that you would want patients to consider that are actually helpful in kind of managing this process that don't involve, continuous painkillers and all that, because all those things still have an effect later on, right? So for, and I'm mostly looking at maybe I'm kind of also considering from my situation where I've kind of tried like how does dieting affect this? And for me, I've discovered sugar is apparently a big thing in kind of creating my inflammation. And I've been able to kind of reduce my pain based on that. But I'm wondering also, like, I'm realizing there's a lot even when it comes to even what women eat and how that affects our hormone fluctuations. And also those things, we also don't talk about them. And so like, in terms of management, even after surgery, to make sure people don't, and especially when you're trying to also preserve your uterus, right? Or to try and kind of even live and just live a normal life that doesn't require you kind of being bedridden all the time.
Yeah. So thank you. I think let's put it this way. There are few dictums, at least with endo, that now I am very, 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 strict about. Number 1, repeat surgeries is a no-no. I don't like it, and I don't advocate for it. I was saying is first surgery, best surgery. Second thing, surgery for endo is a complex surgery. Surgery for endo is not for everybody. So, looking for the right surgeon for endo surgery is very key. Fibroid surgery, anybody can do who's trained in gynecology. All right? Cesarean, anybody can do. All right? Hysterectomy, anybody can do. Hysterectomy for endometriosis, not everybody can do. Okay? Endometriosis surgery, not everybody can do. So when you tell me these repeat surgery issues, it's maybe also because they've not probably had the endo surgery that I'm talking about. That's number one. Okay? Number two, in the past, people have been doing burning, ablation. Oh, I saw endo, I burnt it. Zero. It does nothing. The disease remains there. Okay? You can't burn endo away. You have to excise endo away. It is like having a weed in your shamba. And you going with a slasher and just slashing them. Tomorrow you come back, this weed has sprouted again. Yes or no? You left the root. How has it helped? The way to remove that weed is to dig and remove it from its root. Make sense? So endo surgery is always excision surgery. Okay? Now, not everybody does excision surgery. This is what I'm trying to tell you. Those are the questions. Then, after you do the surgery, it doesn't end there. Many times, you now have to resort to lifestyle changes, complementary and alternative medicine changes, and medical alternatives to suppress the disease from coming back. You've heard people say they have taken Zoladex, they've taken Vizen, they've taken... Those are not bad drugs, by the way. But being given without the disease removed does not help. Understand, if there's an endo nodule, you load it and load it with kilos and kilos of Vizen, it's not going to help. But now you've had a proper endo surgery, you've removed all the lesions out, and now you put her on a suppression treatment later, it prevents recurrences. Those are two different scenarios, guys. All right? One is you're trying to suppress the disease that's there with medicine. All right? And you think it will work? I'm sorry. It's not going to work. It will quieten it, but it's not going to get rid of it. Your pains are not going to go away. Your symptoms are not going to go away. They might just quieten for a while. Are we clear on that? So there are options. Diet, lifestyle, meditation, yoga, acupuncture, some herbal medications. They are options. All right? Diet, cumin is good. Gluten is bad. Red meat is bad. All right? Dairy is bad. Sweet is bad. So these are things that are bad. So we know this. And then we say this is bad, and you go up there today afternoon for lunch and you'll have sweets there. And I've seen people circulating sweets here. All right? So, I'm sorry, but yes, they are not good. You're right. Those are not good. So there are certain things that are not good. You modify your lifestyle, you can try and keep it away. That's what I'm trying to say. And to tell a girl not to take chocolate is difficult. It's like, you see, how do you tell them not to take chocolates? Yeah. But anyway, got it? So this is how it is. It's not, please, I've operated on someone with 11 previous surgeries. 11 previous surgeries. I did the 12th surgery. All right? So what I'm trying to tell you is it's not about how many surgeries. And I'm not promising if I've done it, it will never happen again. I'm not God. But I know what is required to be done for an endo surgery. I try and do what I best can do. I will even show you what I've done and show you the nodules we have removed and everything. But it can still recur. But I can guarantee you, I will delay that recurrence for sure. You get what I'm saying? And after I did that 12th surgery, I think around 5 years ago, she's not had a 13th surgery. So this is what I'm trying to explain. That there are things about, we've had repeated surgery. I know, but you've not had an endo surgery. Let's put it that way. There is a difference. Okay? Any other questions? Yes, I think we can take last. Almost done? Yes.
Hi, I wanted to ask about, you talked about adenomyosis debulking and that it's not a final surgery. There is a possibility of it progressing. I wondered if you could mention a little bit more about that, like what would cause it to progress? And then what would your advice be based on the patients you've seen with adenomyosis? My experience was that with every pregnancy, the condition got worse.
Yes.
And since I stopped trying for pregnancy and after my last surgery, I'm much better. And so would you recommend that somebody would try again or just, kill that idea and don't allow for the adenomyosis to progress?
So one of the theories for adenomyosis is called TR, TIAR. That's a cause for adenomyosis. TIAR stands for tissue injury and repair. The tissue here referring to the uterus. So anything causing injury to the uterus and repair. Injury and repair. Injury and repair increases the risk of adenomyosis growing. What is injury and repair? A delivery is an injury and repair. A cesarean is an injury and repair. A fibroid surgery is an injury and repair. A termination or an abortion is an injury and repair. A miscarriage is an injury and repair. Repeated periods is actually every month is an injury and a repair. So we give you medicine to stop your periods, it slows down. Are you getting it? You get pregnant, injury, and then your body repairs, adeno grows. Secondly, adenomyosis, as is endometriosis, are hormone dependent. So they are worsened by estrogen and they are slowed down by progesterone. So whenever you have your ovaries still functional, they are producing estrogen. And after you ovulate, they are producing progesterone. You get it? So the first half, when you have estrogen, you're flaring up that disease. And that's why one of the treatments for it to slow it down is a progestin. So if you take continuous progestin, depot injection, Mirena coil, you get my point, implant, Visan, Dynogest, you slow it down. You're not giving scope for the estrogen to come in. Are you understanding? It slows down. It does not treat. It does not disappear. It slows down. So when you have had a surgery, now you're recovering, you get a period, and another period, and another period, you're letting the adeno grow back. You get pregnant, you are letting the adeno grow back. So let me explain another advancement in adenomyosis, by the way. All right, for those of you, these days we are not fond of adeno surgeries. I'm not, except when it's extensive surgery, but we are not fond of debulking surgeries. All right, endo surgery is fine, it is very clear cut. But you know why this is not fine? Because you weaken the uterus and you still don't clear the problem and it comes back. So we are not fond of an adeno debulking surgeries unless it's extreme. Got it? And in extreme surgeries, many times we then have to do open surgery for adeno. I do laparoscopy as well, but not for extensive adeno. If it's extensive, I'll still do it open. Are we getting it? Because the repair then can be done in a better way. But for adeno, there is one more player in the game that I need you to know about or hear about. It's called HIFU. HIFU. High intensity focused ultrasound. High intensity focused ultrasound. It's not a surgery. There is no surgery involved in this. It's an ultrasound. But it's like an MRI machine. You lie down and they'll map this adeno in you. Then they'll direct some focused ultrasound on it, which will go and hit up the adenomyotic lesions and try and destroy them. No cut whatsoever. So for young people who are still intending for fertility and the main pathology is adeno, not much endo, HIFU is a very good option because you leave the uterus wall the way it is. You don't weaken it. You get what I'm saying? You go and just destroy the lesions. Until now, we've not had HIFU in this country. We now have HIFU for the last 2-3 months now. We have it here in Nairobi. Okay? So, not me. I'm saying I'm not involved in it, but there is a HIFU center that's come up in Nairobi. So for some of my patients who come and see me, I then prep them, I plan it, I map it, and I talk to the HIFU center and I send them over. This is something you might want to consider. If you have adeno, you don't want a surgery, you have pain and heavy flow, it's not extensive, you can do HIFU. Got it? Sawa.
Maybe before we wind up, I would like you to talk about IVF.
IVF.
Yes, IVF London at Third Park.
Oh, okay.
Yes, touch a little bit of that, kindly.
No. So anyway, I mean, you see, I told you this center now is in operation for the last 3 years plus. Okay? And when I started this, dream project, I call it my dream project. I started this dream project in 2016 in my brains. Okay? To be operational in 2021. So it started with a dream project in my head. And, knowingly and unknowingly, all the people that I brought involved in this center were affiliates of an Endo group. I have an IVF specialist. I have an Endo specialist like myself. I have pain specialist. I have a physiotherapist. I have, so I have the whole group, a gastroenterologist, a urologist, a colorectal surgeon. And then it then stuck on me, and then I realized, actually we've made this because of endometriosis. But it's actually a full-fledged hospital that does all kinds of surgeries. Now, part of this was fertility, because adeno and endo does impact fertility outcomes, all right? And therefore, we also developed an IVF center in this unit, okay? So this unit has an IVF center. And from last year, October, we merged with a group from London called IVF London. Now to bring in advancements in IVF in this region. So some of the equipment, some of the additional, specialty add-ons have been brought in for the IVF facilities in this region. So there are very many of you who have adeno and endo who will come across the discussion of IVF. Let me tell you that, okay? It will come somewhere or another in your discussion. And when it comes there, then you need to look for a center that has the knowledge of both endo as well as the IVF. Because doing IVF in a center that deals with endometriosis may make a difference, because they know, they understand. And many times you will have heard these women, and I don't know if any of you are here who might have experienced that, we even tell them before the endo surgery, let's retrieve your eggs. Let's freeze your eggs, okay? You freeze them because the surgery leads to a drop in your ovarian reserves. You understand? So don't go for a major endo surgery without having a backup. Go put your backup. Once you have your backup, let me tell you, you'll be very relieved here. Because now you know I could get pregnant at 45 with my eggs that were picked up at 28. You understand what I'm saying? So this is why that planning is important. Clear? So I think we do have IVF London at Third Park here that obviously deals with the combination of IVF and endometriosis as well. Okay? Thank you. Yes. Okay. Yes, please.
Hi, Doc. My name is Juliet.
Hi.
I've had several surgeries, repeat surgeries. Unfortunately, from that, I've been told. Sorry, I've had several surgeries, almost 5, unfortunately, from different doctors, and every time, like from the third one, I've been told I have adhesions, scar tissues, and when they open me, the next doctor will tell me there were so many. So I was asking, are there interventions to avoid the scar tissues after surgery? Yeah.
Have they been open surgeries or laparoscopic surgeries?
Some lap and some.
Yeah.
open.
So my answer to that is, yes, scar tissue is a risk for every surgery. Every surgery you do, the scar tissue forms again. But how the surgery is done makes a big difference in recurrence rates. So all our tissue inside have planes. So you see this is a cloth on my skin. It's not stuck. There's a plane. Now, if I operate in this plane and then I leave this patient like this, it will not stick. But if I just operate anywhere here, then this tissue will get stuck very tough. You get what I'm saying? So that is something we've been teaching whenever we do. It's called anatomical surgery. So if we do anatomical surgery, and endo is one classic example where planes are lost. But if we do anatomical surgery and we look for those planes between these structures that are stuck, and we are in the right plane, it will not seal again. So planes and anatomical surgery is one thing. Now that is a skill thing. All right? So that is one aspect. Second aspect is there are some adhesion barriers that we can sometimes use to prevent them from reforming. They don't work as well as the plane surgery. So when you follow the planes, it's better. But once you've already had 4 or 5 surgeries and they've been telling you it's very bad adhesions, I don't think you'll ever reach a point where there'll be no adhesions. But we can see how to reduce it by trying to follow planes. You get what I'm saying? But that's a risk factor that has already developed. So if done in the right planes, the adhesions don't form. All right? I have seen patients in whom one surgery, cesarean, was done somewhere, let's say in the remote area. The next time they come here and I go into the abdomen, if I have to go in the next time, and it's an Amazon forest. All right? And then I have done patients where I've done surgeries 5 times and I'm going in for the 6th cesarean, and there's 0 adhesions. And I'm not saying this just for the sake of saying this. I have enough proof of all this. So the right planes does not cause adhesions. The wrong planes will leave a forest in there. You understand? But once they are already there, now it becomes, I'm saying it should be from the very start. You've understood. Once one starts badly, it's very difficult to clear that pelvis.
So there are no interventions?
No, there is. That's what I'm trying to tell you. It might have to be still, again, adhesiolysis, but now following the right principles and planes. All right? But if they are bothering you, if they're not bothering just because they are stuck, no, we don't need to go into that abdomen repeatedly. But what I'm saying is bothering means severe pain or sometimes obstruct. You know, if you have adhesions near the bowel, it kinks the bowel and then you get an obstruction. Now you have no choice. You have to go back in to release that adhesion. But when they now do it, let it be laparoscopic, number 1, if possible, not open. Open messes it up more. And number 2 is let it be following the right plane. Now, that is not in your hands. That's the whole thing. That now depends on the surgeon. You've understood? It's a surgical thing. Okay?
There's an online question. Let me read the question. After successful endo surgery, can you take a break from hormonal treatment for suspension, then resume after, say, a month?
A month is not a problem, but we should discuss why. Why someone wants to, is it the side effect profile? What is the issue? But otherwise, stopping it is inviting recurrence. All right? So I'm not saying that you have to be on it for lifetime. And I'm not saying you have to be on one type for lifetime. You could even change between different options so that you have different side effect profiles and you don't let one continue for so long. But leaving it alone, letting your own hormones come and kick in again, is again inviting recurrences. So not all the patients actually of mine have to be on medical suppression. If I've done a proper clearing procedure in the pelvis, there are very many of my patients who are not. And especially if their fertility is their goal. If fertility is their goal, we never put them on hormonal suppression. You get my point? We now try and target the pregnancy, not medical suppression. So it's not mandatory. But for your question, if you have to stop it for a month and restart, it's not a big deal, but it's better to discuss with your doctor as to why you want to stop it for a month, because you're not benefiting in a month about the side effects. They'll still remain when you restart it. And secondly, that stopping for 1 month might just risk recurrence. So discuss it with your doctor to decide if it is still better or not to stop for a month, okay? Thank you. So with this, by the way, I mean, over this month of endo awareness, these my young people, young kids, make me do things that I shouldn't be doing with my gray hair, but they put me on Instagram and they've been telling me TikTok, and I'm like, no, I'm not going to TikTok anyway, all right? But we've actually, that's something I'm very excited about, and we want to actually launch a song that we've made for endometriosis today, and we are going to be calling it the Endo Song. And these young people of mine again have said we'll put it as a challenge and let the youngsters dance to it, and I'm like, okay, let's see what they can do. But I want to play that song for you guys, and that song is then going to go out onto Spotify and everywhere. I want to put it out and let's see how it looks. It's a song dedicated to endo women. Please play it. It's very touching. I loved the song. I don't know how you'll feel. Endo is real. Endo is debilitating and life-altering. Endo is here to stay. You could be one of them, but you are not alone.
From my friends plotting, maybe pain not walking. She don't know the causes. Friends are stacking closes. She don't know to close this. End is real, end is bad. I wanna talk about it. Won't be shattered, won't be scattered. I wanna light about it. Yeah, so my own people go through it, and I was feeling pain. Yeah, I was feeling drained. Yeah, I was feeling change. This condition that's affecting women, and it's affecting women. So I'm standing trying to say no. You need training, you need healing. You know me, I mean it. It's been a minute. I saw my Gandhi, I saw my Andy, I saw my mom and granny. They all feeling stressed, yeah. Feeling depressed, yeah. Nothing to express. And it's spread, affecting scared. So just said, please don't wait for this condition to complicate. Do your screening, get diagnosed, and start taking meds. Early stages can be suppressed. You can start afresh. You know the dope, and that's why I say, yeah. I believe in hope, I believe in change, I believe in more than next time. I believe in hope, I believe in love, I believe in healing, I better next time. Yeah, I'm addressing myths and misconceptions, lack of information, lies across the nation, with endo no conception. Now we get professions, they take us to the sessions, essence of education, raising awareness to reduce tension, on platforms now were mentioned, our ladies are getting lessons, now we are treating endo, no more stigmatization, if it's not doing the section, medical science, innovation, technology intervention, now. I believe in hope, I believe in change, I believe in more than next time. I believe in hope, I believe in love, I believe in healing, I better next time. I believe in hope, I believe in change, I believe in more than next time. I believe in hope, I believe in love, I believe in healing, I better next time. Should we let them suffer in silence? No. Should the world be part of silence? Yeah. Do you think they enjoy miscarriage? No. Should women be allowed to be parents? Yeah. I believe in hope, I believe in change, I believe in more than next time. I believe in hope, I believe in love, I believe in healing, I better next time.
Do not despair. There are solutions. We can guide you from diagnosis to treatment goals. Welcome to Third Park Hospital. We care. out. And then we will actually record a video for the same. If there are any of you who are willing to join and be part of the song and dance, please register with them. We will let you know when we are shooting. But I wanted to roll this out today on Endometriosis Awareness Month. Thank you, guys.
So I think we'll extend with 30 minutes so that we give everyone a chance to say what they wrote. Right? To be fair to everyone. Do you want to take a break? You want to take a break? No. We finish. Yes. 30 minutes. Yes. Everyone to say their word. 2 minutes or 1 minute each. 1 minute so that we can finalize, right? Where are we at? Susan?
Hello, please, let me take over. Thank you very much. Hello. Sorry. So basically, yeah, so look, it's, I mean, a minute, but just, you know what, describe your word. I don't want it to be unfair. It's just that we've gone past. I know it's an emotional session and I know it's going to, but just even if whatever you feel, just speak it out, okay? I'm really, really sorry that I know some have left, but unfortunately, this is what happens in a time-restricted session, but there will be many more. So don't lose hope, okay? So let's describe what our word is and how it's made you feel.
Good afternoon.
Afternoon.
My name is Susan, and the word I put down is excruciating. Excruciating, I would like to add it on to, I don't know, draining. Draining is the other word for me because for a very long time I suffered this from high school since I began my menses and I didn't know what was happening. So all you are told is, vumilia, we all get the period pains. It's kawaida, so you're not the only one. So as time went by, it became worse and worse. And it's depressing, honestly, for me. Excruciating in a manner that it makes me feel every month I have to miss work for 2 to 3 days. And where I work, it's so difficult for you to explain every month why you keep missing. Why do you have to be absent every 2, 3 days? And I resonate with her when she says, you're due for something very important, but then you have to miss work. Sometimes you can't walk, and really nobody can understand how much pain you're going through. So that is what I choose to use. And I thank God for this community. I will be joining today because I didn't know the community exists. I was just informed a few days ago. So thank you, Warriors, for what you're doing and the support that you're offering us ladies. Thank you.
Thank you. Thank you for sharing with us your word. Obviously, excruciating is something that we all resonate with. All the words we're all coming up with are very familiar, very, very familiar. And yes, after this, we do have WhatsApp support groups as well, led by our lovely lady here. But we'll go into details about that later. Tell me.
Hi, everyone. My name is Janice. So the word I wrote down is exhausting. It is exhausting physically, emotionally, mentally, even spiritually and financially. And someone talked of how much it puts them down to the fact that even a part of their body, a left side of their body is down. That is me right now. I think that was you that said that I feel so much pain on my left side. I don't understand why. It's tiring having to keep explaining to people, Janice, why don't you have so much energy like you were before? What do I tell them? You know, why has my gait changed? I can't explain that. I've gone through so many doctors. Each has their own plan. We do this, it doesn't work. I go back to them, I go back to another one. It is tiring. So that is what I thought I'll put down. And someone talked also about loss. You feel you lose yourself, you grieve the person that you were before. I've been feeling that. I was a very energetic person before. those 23 years dealing with it, having been diagnosed after 16 years, I thought, wow, now I'm going to be okay. And then a shocker, I get worse. And it gets worse every year. But I said, you know what? I will not allow it to bring me down. I have a very supportive husband here. Today, imagine today my energy levels were down. I was lethargic and he was upbeat. And I was like, dude, why are you happy? Why are you lively? But he encourages me in every action. When I am down, when I am extremely tired, he'll be there to do everything for me. So I appreciate the support I get from him as a loving husband and my family and my friends and this community. So I know it brings us all down. I resonate with each and every one of your experiences. It is personal. It has touched me. I have cried with you, but we're going to make it. And let's continue raising awareness so people can understand us more, because it is very impactful when you tell someone about your issue and they're able to understand and they help the next person. But if we keep quiet about it, that's when someone will be like, "Sini period too," you get? So we need to keep doing it. So keep on doing what you're doing, and thank you so much for this session.
Thank you, and thank you for sharing. It is exhausting. No, you must share, because as much as she said that you've been upbeat and I was looking at your facial expressions, and I'll tell you something. I know how I can see it, how deeply affected you've been, and how emotional it's been for you as well. You're being strong, but I can actually see your pain for her in your face.
I suffered kidney stones. I had a case of kidney stones sometime last year. I was rolling in bed and crying, and then she was like, "Now, why do we have to go to hospital in the middle of the night?" And then I read somewhere, what endo pain does not even compare to labor or even kidney stones, and then I shut up. Then I told her one time, if I honestly had to go through the pain she goes through every time, I'd have died. I'd have died a long time ago. So you ladies, honestly, really, really, really strong. Despite the pain, keep the faith. We know all these things one time will just come to an end. That is the assurance we have. That is the faith we keep. So keep fighting on and keep. I thought I'm not a fan of these groups, first of all. She knows, because I've heard of one or two that she goes through or listens to, and I call them toxic at times, because I feel like people you don't end up feeling any better than when you got in, but that is not the feeling I have right now when I walked in. Yeah, so
I'm
keep
glad.
up.
Thank you. And thank you so much for all your support that you're giving your lovely lady. And you are amazing. You will have moments of feeling down and everything, but you're incredible. Okay? Each and as I keep saying, every one of us here are amazing. Okay? It is exhausting, it is excruciating. We have the loss, we have every emotion that plays with it, that comes with it. But look at all of you here. Look at you, each and every one of you, through the tears in your eyes, you are still smiling. You know, I mean, if that is not strength, like, I don't know what is. You know, this is real strength. Each and every one of you right here is real strength. So I'm really proud of each and every one of you. Tell me.
Hi, everyone.
Hi.
I'm Gloria. Mine, I'll say, is scary and unpredictable. Scary, yeah. Unpredictable, yeah. Unpredictable because 1 minute you're okay, the next minute you're in pain or low energy levels. Try to do the blood test, see a gynecologist, nothing is found. You try everything, nothing. In a month you're sick, you have no energy. Next time, I don't know, it's just bad.
I know you're shaking and you're smiling and saying that, but wow. Very, very, I'm really proud of you. It's okay. You can release it. It's fine. It is unpredictable, and it's the unpredictability that actually leaves you debilitating with every aspect of your life, especially because, you know, with your education, your school, I mean, your work, everything, all of it. It's okay. Yeah? You're right. Thank you for sharing. We're very proud of you. I mean, literally, I was looking at her face. I don't know if everyone was looking at her. She's saying all this. Her hand is shaking. She's shaking with emotions that she's feeling, and yet she said everything with a smile. Like, I mean, come on. Like, this is strength. Like, what is the definition of strength? Each and every one of you, each and every single emotion, everyone here. Thank you. Tell me. Okay, take your time. It's fine.
Okay. Hi, everyone.
Hi.
I'm Tina. I know I'm already crying and I'm not even there. So my word that I wrote was broken and loss. So I'm not going to explain the story because of time, but okay, I can start explaining. Okay. So it has been a long journey, and I think I'm one of the people who are product of misdiagnosis and delayed care, because since I started experiencing my menses, it has been pain over and over, and the way community say it's fine, you'll be okay, it's normal. Then after the periods, I'm okay. So nobody took time, my family, like nobody took time to take me to a doctor. So by the time that I'm able to do that is when I started working, and I looked for a gyna, and he told me it is just the polycystic ovarian cyst, and you'll just be fine. Take COX for like 3 months, will be fine. But the pain was there over and over, and it was getting worse over time until 2022 that I met Dr. Ozel, who referred me to Dr. Jagi. And by the time that I was coming to Jagi, things had gone worse. It was my 3rd surgery, and the previous one, they used to tell me it's just endometriosis, but it's in the 1st stage. But by the time I saw Ozel, it was in stage 4. So it had spread to the intestines, to the bladder, and he told me that we do a Mirena and we see how it works. And the way Dr. Jamal has said, I can attest that you having the Mirena or those drugs, it doesn't help, because there was no improvement. I had that Mirena and things were even getting worse. Then when I saw Dr. Jagi, we decided to go in and see how things were. We did a laparoscopy, and apparently they have spread to the diaphragm. So last year in September, we did hysterectomy. I do not have a child. I'm turning 30 on Monday, and I love kids. I know most of us have said that they had like that. I really love kids. I'm a pediatric nurse. I really love kids. So I'm so broken that I'll never have kids of my own. Yes.
Thank you. Thank you for sharing that. You're a pediatric nurse, and you feel broken because I understand the loss of not having a child and having to do a hysterectomy when obviously you love children. I love kids. Like, I understand you completely. But look at the other hindsight of it, and this is where I'm trying to help just to flip the narrative, because obviously of the emotional toll that this holds on us. Look at how many children you take care of on a day-to-day basis. The ones who need you the most, God provided you with that blessing to be able to take care of all these beautiful children who are under you. I mean, how blessed are they that they have the most caring? The reason I say the most caring is because as mothers, yes, you know you have that, you know the child is yours, and you know you have a responsibility to take. But here, something was taken away from you, and instead of you running away from that scenario of being around children, you're tackling it with immense love that comes from a place where it's so selfless, yet it's been rooted from pain. I mean, that is incredible. So well done. That is beautiful. So thank you.
Thank you.
Oh, it's okay. Listen, we're not here to thank. Like, you don't need to thank.
Thank
I'm
you.
thanking you all because this is what it all is about. You know, it's about each and every one of you. Thank you.
Hi everyone.
Hi.
My name is Shirokihara. Hey, niko tensed.
It's okay.
I'm also a product of misdiagnosis. 4 surgeries in.
Okay, hold up. We're not products of nothing like that. We're not products of any negativity that is beyond our control. You are an endo warrior and you're sitting there. We are not endometriosis. We're not adenomyosis. We're not products of any of it. We are God's beautiful children who have this journey that we have to go through. Okay? Cool. Thank you. So rephrase your sentence.
Yeah, so mine has been, my word is overwhelming, mainly because it took almost 12 years before I got a diagnosis. I'm a midwife by training, so it's been difficult, especially when you go see a gynecologist and you are told that you just need to get pregnant and you'll be fine. It's also been very difficult when you find your colleagues don't actually understand you, while they are the same people who should be understanding you. So I remember there's one time we went to see a gynecologist with my mother, and she was told mirroring what I'm being taught in school. So it was kind of projecting what I'm learning. So of course, my mother is not in the medical field. So for her, it made sense, which of course led to, you know, the delayed care. And I think for me, it got to a point, I have heard someone say they were also blacking out over and over. And it makes me feel it's not only me, because, you know, you are 1 minute you're taking care of a patient, and then the next minute you're down, the next minute you're okay, the next minute you're down, and it's not been easy. And I think by the time my diagnosis was done by Dr. Yamal, and I thank God for, you know, the many ads that pack does on the social media platforms, because I think it was the first ever Endo marathon. That was, I think, 2022 or 2023, thereabouts. So I saw a Facebook pop-up, and I had just been discharged from the hospital because, you know, you're admitted, you go through all the necessary tests, you come out, you're okay. You've had 1,000,001 ultrasounds done, ziko sawa. And so that Facebook pop-up kept coming, and I decided to sign up. And that's when I got my diagnosis. And then I did the first endo surgery in 2023. But by this time, I had already lost my ovary and my fallopian tube due to misdiagnosis. And then we did that surgery with Dr. Njagi. Again, Dr. Amal connected me with Dr. Njagi. And it was not easy. The recovery process was not easy because the disease had spread kidogo. And then I thought that would be the end. Unfortunately, again, I had to do another surgery last year, lost my other fallopian tube. And it becomes even more difficult. Like I was telling her when we were coming, We met at our hospital bed.
And look at you now. I tell you, the universe has a weird way of making you meet people.
Yeah, and we actually didn't know we were both in the medical space. We were laughing at each other, doing the TikTok challenges because there was nothing much to do. I like to think myself as a really strong girl, which sometimes I would actually discourage, sometimes because you don't get time to go through your emotions and what you're feeling, because now everybody else tends to lean on you and you do not have a person to lean on. So as I wind up, maybe the one thing I would want to get off my chest, I was telling her this. One of my colleagues, I'm 30 years plus, I do not have a kid. And of course, now IVF is my only option for that. Yeah. So the other day, a colleague of mine told me I'm wasting my youthfulness because I do not have
You're
a
doing
kid.
what, sorry?
I'm wasting my youthfulness because I don't have a kid.
Okay.
And it's not easy, especially again, I said I'm a midwife, so my work is bringing babies to this world, yeah? And when some of these utterances are made, it takes a toll. And I'm grateful for this opportunity because for the first time I feel tensed, which is really not a usual feeling. I'm not used to this feeling. I feel like crying. I don't cry.
Cry.
So all these things are new emotions that I'm learning to deal with them. So I'm grateful for that.
No, I appreciate that. And thank you for sharing your story. What I want to say is that this is why this session is here, obviously I wanted to do much more, but we will have sessions again because we still have about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 girls who need to just quickly say their words. But that's why just keep your stories limited and say out what you want to say. The thing is this, this is where you learn the tools to, when people come and tell you things like that, I know it plays a toll on you, but we are the ones, and this comes with practice and time, and obviously you fall back into the pattern. Where is that comment coming from? Who is that person who's giving you that comment? Are they worthy of telling you anything? Are they valuable? I mean, why even listen to it? It's easier said than done, and I know it, but it comes with practice. Look at where you are, look at what you're doing, and look at your journey. Has she even walked? I mean, whoever that person was, what has their journey been about? I mean, maybe they're going through a lot as well, and they needed an outlet, and unfortunately, you were the punching bag. Yeah? And this is where that whole level of empathy comes in, and I know it's unfair, but because we're already going through so much yourselves, and you're thinking, I don't need this. You don't need it, but we have the ability to create the filter that we need. Everything that happens that we listen to, we take, we digest or whatever is all within us. Create a safe bubble around you so that any unsolicited advice bounces off them. Goes back to them, smacks them however it wants to smack them. Yeah, and it's easy. I know it's easier said than done, but if you practice this mindfully, it's possible. It is not impossible. Okay? Cool. So we have a few more. I don't want to, it's important practice, so we're going to take it, okay? Because we have you lot here, and we have the 2 here, and we have the 4 there. Oh, 5, sorry. You're new as well. Thank you. Okay.
Hi, everyone.
Hi.
My name is Mercy. I was diagnosed with adenomyosis, endometriosis, and ovarian cysts last year. As much as they say it's good for them to be diagnosed when you're young, it's also very depressing. For my ward, it's a roller coaster because there are some ups and downs. Some days you have the energy to overcome these, and some days it's very difficult having to explain to everyone why you're missing school, why you're not at the clinical areas. I'm studying nursing and I'm in my final year, but it's very hard missing clinicals because other students are there having the experience that you're missing, and you have to come back and catch up with them, and it's not something easy. And also, it's very sad being told that personally, my surgery was last year, but I had a checkup early March, and unfortunately, I was told my cysts are back, and they're very big, and Dr. Njagi says he doesn't understand why they are coming back. They are corpus luteal cysts, but they're still coming back, and they have to be removed every time. And that is depressing for me because I have to go back to surgery. As much as I'm in the medical field, it's very scary. And when I went for my first surgery, my blood pressure was very high. I was almost in a hypertensive crisis. And as much as it's so scary, I would really love to thank my family and also for my partner who has been helping me with the support. Like even for the community we have for the endometriosis, it's very helpful creating also awareness, and it will help others achieve and know about endometriosis.
Thank you. I want you all, you can all clap for her and her partner before the partner speaks. I want you all to know that you guys, you all need to be the voices for the voiceless, because this is how awareness is spread. It's circles like these, communities like this, that where you get the support, you spread the awareness, and you get to learn a lot. In terms of your cysts and everything, this is the thing, you're in the medical field as well, right? And this is the thing about endometriosis and adenomyosis, and also a lot of the menstrual health illnesses that come along, with PCOS, fibroids, all of that. Unfortunately, it's also what we put in our bodies. You'd asked about the diet question, and obviously the doctors are there for them, from the surgical side, and they will guide you in what they have to do. Ask us, do you journal? Do you journal? Do you write down everything you're doing? Do you know your triggers? Do you know your where is your highest levels and where are the lowest levels? You do all that. Then you start eliminating. Have you done food allergy tests? A lot of food allergies. I didn't know this until I did it myself. I've done 2 food allergy tests, and I didn't know I was allergic to so many foods. It's unbelievable. I was allergic to things like watermelon, cucumber, stuff like you'd think beetroot, and you're thinking, what do you mean? And all these allergies activate inflammation. So when I eliminated all those food allergies that I had, also product allergies, your surroundings, dust, pets, anything. When I eliminated a lot from my diet, like I have a very, very limited diet, but when I eliminated it, so much of the pain levels and the inflammation went down. So diet does play a huge role, obviously. Mental health mindfulness plays a huge role. Meditation, yoga, exercise. We also have another event coming up next Saturday, but that we can talk about. You can reach out to Doris later on when we're upstairs about exercise, how exercise plays a huge role. I have won't embarrass. I have my trainer here who's amazing, has done amazing stuff with movement, which I did not know how bad endometriosis and adeno for myself affected my joints and my muscles, and just everything. I have neuropathy from endo. I didn't know how fickle my wrists were until I started doing these movement classes. So you have to invest in yourself. You have to take time, and you have to make the effort to do it. It's hard. It's not easy, but we have to do it. Unfortunately, I wish there was a quick fix. I wish there was a magic pill. I mean, everybody would wish that, But unfortunately, we are our magic pills. Okay? Thank you.
Hello, everyone.
Hi.
My name is Levi, and my word was baffling.
Nice.
Baffling in the sense that at first it was confusing to a point that you're constantly unsure of what's going on with my partner. Why is she so quiet all of a sudden? She doesn't understand what she's going through. She's in a point where she's scared. And as a partner, especially with our current generation, sadly, you'd find that our generation is so dependent on perfect things. So you'd find, okay, out there, what's trending, you'd find if you feel or you see what other people are living like, they have perfect lives, they're healthy, they do this, they do that. But then again, come to think of it, no one is perfect. And that's our maker's, nature. And in this world, we are always told to embrace the good things, our imperfections. In fact, I once read somewhere that embracing and loving our imperfections is what makes us perfect. And with her, she's my perfect.
Aww. This is the proposal coming up.
So,
It's okay. And that is strength right there. So don't take it as a weakness at all.
So, her being freshly out of high school and me freshly into college, it was a whole different experience. And I took it as a learning journey. And sometimes you'd feel as if maybe in the wrong place. But then again, I would tell myself, no. There's a reason as to why I'm here with her. And with time, I was able to compose myself, be there for her, put my ego aside, which is a problem for most men, especially right now, and put her as my first priority. Focus on what she feels, make her feel better of herself, stronger, despite her being through school and everything, and also being around friends who might not understand what she's going through. I tend to make sure that I do my very best, give her a safe place to come and vent out, feel comfortable, take her anxiety down, channel her depression somewhere else where she can just take a breather, because this journey is tough. And I want to say to everyone, I'm so proud of you for being brave, keep on fighting, and we're always together in this. Thank you.
You can hug each other. It's all right. Go on. You deserve a hug. Thank you. Thank you so much. And you know what? Thank you for also showing your vulnerability, because, this whole social media and your exposure, your generation, the exposure you guys have to this whole, how much out there, as you said, how much social media impacts your own lives. It's insane. It's ridiculous. And the fact that you can acknowledge that and differentiate it and making a step forward to making it better is amazing, because recognition is a big thing. It's a game changer. And thank you for all your support for her as well. Because in all of this, don't forget that you're your own individual as well, right? Because far too often as carers, we can forget that we are ourselves as well, and you need that time, because if you can't keep pouring from an empty cup. I've got eyes saying that I need to wind up. All right, go on, tell me. Yeah, thank you. Yeah, mention and just have a brief of why you've chosen the word. Just a brief, okay? Yeah, 1 minute each. Sorry. Here. Oh, yes. Sorry. Come.
Hi, everyone.
Hi.
My word is overwhelming. I think that has come out quite often. And this is because Endo affects all aspects of life. Mine was first, physically, all the symptoms, then spiritually, so many questions to God, and psychologically, having to carry this burden alone, and financially. I thank the team that is reaching out to the insurances, and I pray that this continues, because one of the other challenges that I had was insurance, and I'm happy that we are reaching out to them. I hope we also reach out to this Shah, whatever that is. Yeah. And I can also say thank you to Third Park. I had my surgery last year, and thank you to Dr. Njagi, to Third Park, to Felistas, and people who are involved, the nurses and other doctors. Thank you.
Thank you very much. Thank you for sharing your story. Thank you. We'll keep it short, yeah? Just tell me what your word is.
My name is Grace. My word is fear, scary, and loss. I have had, I was misdiagnosed, and they always told me to get kids so that the pain could go away. I have 2 kids, thank to God, but the pain is still there. But still, I can't afford the treatment. Sometimes it is so painful that I fear I can die, or sometimes very painful that the kid is crying and I cannot pick him up. And it is very scary. What if it gets worse and I cannot afford? Yeah.
Thank you. And through that fear, I want everyone to clap. You can take the, I want everyone to clap for her. Because through that fear, as much as you say you have fear, look at what you're doing right now. You're a mom of 2. You've come all the way to take time out to be present here, and look at where you are. That is incredible. You're an amazing mom, and you're an amazing human being yourself. So thank you to you. Thank you. You're very brave.
Hey everyone.
Hey.
My name is Janice, and my word is what the fuck. I feel like Endo kind of dragged some rug from under my feet. I was diagnosed last year. I thought I had a plan for what my life should look like. And I remember specifically this one question where my doctor was like, do you plan to have kids? And I was like, yeah. And he just went like this. And I was like, and that for me, that was very painful because, and especially also like, I lost my grandma recently, and that kind of just brought it all back because I was just like, I wish she had lived long enough to see me have a kid. But then also at the same time, I'm like, is it even gonna happen? You know? I think, but one thing that I didn't do is let this thing kind of get to me so much. I was like, I'm going to fight for myself as much as possible. And like you mentioned, things like putting my mental health first, and also like figuring out like, because for me, I was put on Visan first because I wasn't ready for surgery at the time. And weirdly enough, at the time, I'd also just quit my job to start a business. So I'm like, I just figured out what my dreams are. And then all of a sudden, I have to deal with chaos that my body, you know, has brought on. So it really helped to kind of just, the Visan kind of gave me depression, so I had to get out of it. And then, but then being able to kind of diet, especially just getting rid of dairy, sugar, and that really kind of helped with me being able to push on, do things, exercise, those things. They've been useful for me in pain management because I've honestly been able to, at least with my period, I've been able to kind of reduce it to just 1 day of pain as opposed to like 4 days of sleeping. So there's positives when you kind of actually decide, I'm going to kick your ass, and not the other way around.
Absolutely. Absolutely. Thank you. Thank you. On that side, just remember, just be mindful also that remember every story, every journey is personalized, individualized, there's no one size fits all. So you have to understand and do things that work for you. Okay? Yes.
Hi. Yeah, my name is Winnie Adika. I've suffered endo for almost 20 years, but it is now 16 years since I was diagnosed with it. One word is being strong. I pick being strong because from the time I was diagnosed, when I was roughly 23 years, to now when I'm 39 years, all those years, being strong has assisted me. Some days, yes, you try to be strong, but you are worn out. I try to listen to my body and to listen to myself.
Thank you.
I've suffered loss, but being strong still assist me. Okay, just to the lady, when someone tells you that you need to get a baby, just punch by telling her, is there a pregnancy of yours that is lost or a child?
No. You just say thank you. Why feed the energy? Why feed the energy?
I
That
know,
energy
because-
we use for ourselves. You just say, yeah, thank you. That's it. Sometimes
That one
silence
I
speaks
said.
louder than words. I hear you though.
You know, it depends with the way. Maybe that time you are in pain.
Of course.
Someone tells you so.
Of course.
So you just tell her, just to zip. Yes.
Thank you. Thanks, Winnie.
Hi everyone, my name is Juliet.
Hi,
And the
Juliet.
word is disappointment. The reason why it's disappointing is because every time you get sick and maybe you are told surgery might help and you go for surgery and then you are hopeful this thing is going to go away. Interventions, you try a lot of interventions, herbal stuff and all that. And the disease is still there. Disappointing also because your life kind of has stopped. I was a happy girl, a party girl. I can no longer go partying. I can no longer have even go shopping. Friends will go and you'll tell them, can I come along? They're like, wait, we'll tell you. And they will not argue along because they know you're a burden. You'll start telling them, I'm feeling pain. We can't do this. Yeah. For me, it's disappointing. And it's also boring because sometimes you're sick. You want to do stuff, you can't. You're sitting on your bum because you've had surgery. So, yeah, those are my words.
Thank you. Thank you for sharing your thing. And let me tell you something. Just put your hands up. Both of them. Everyone just put your hands up. And just pump it up. He's a party. Okay? All right? We make the space that we're not, that this illness has taken from us. That's how we beat it. Small steps, baby steps. Okay? Thank you. Yes. Hi.
Hi, everyone. My name is Diane. I came late and I don't have a word.
Okay, so I'm going to cut you right there. Sorry, because I know you're about to express yourself. What has Endo journey made you feel?
Lonely.
There you go. That's your word.
I
It's
can't
okay.
do this today because right now I'm in pain actually. And it's fucking me up and
Dan, take your time. You are doing this. It's not you can't do it. You are actually doing it.
let us know despite the pain, we'll speak and then at least we'll feel relief in a way. Wow, okay. I've never been here before. I just got an invite. She actually invited me because I texted her at around 5 in the name of, yo, I'm in pain and I just need you to recommend something that I can take to ease the pain and the flow of the blood. My menses are quite disturbing. It's just flowing like, it's like a tap has been opened on my fallopian tube. I can't stay with a pad for 10 minutes, of which it is annoying sometimes. I've missed work for a couple of times now, and you know the way it's so hard to tell someone I cannot come to work today because of this and this, and you can't go and explain to them what you're going through because it's like they won't understand at the end of the day. So I always feel alone because I'm alone at the same time. My mom is not with me and I don't have friends. And I feel like I'm a burden to myself and I just feel alone. For today, let me just stop from here. And it's good to have such a community. It started when I was a baby and I don't understand why. Right now I feel like, I feel good. Actually I feel good talking.
Good.
Thank you.
Diane, thank you. And can I just share? Diane is an amazing, amazing masseuse. Okay, she's incredible with what she does. I met her a few weeks ago, and when I went for treatment, I was like, oh my God, we suddenly just started talking, and endometriosis was a connecting factor. And I felt so bad. And I was like, I'm going to let an endo warrior do my massage. Oh my God, this is ridiculous. And she was in pain. And obviously I couldn't, because you're in an environment where you also need to support. But it's amazing, and I'm so glad that you made it, despite she messaged me at 5 a.m. and she was in excruciating pain. So thank you. I mean, it's everyone's story, and you're not lonely. Look around. Look at how many people you're with, and look at how many people you brought smiles to just now. Look at that. I'm really proud of you, so thank you for making it. And let the emotions flow, don't worry. Thank you. Everyone clap her. Hi.
Hi. My name is Brenda. My word is draining. I won't say was, is draining. And I'm going to talk about it in the aspect of finances. There's one thing that we've not talked about is the finances. Most of us, or let me say some of us, we got late diagnosis because of the finances. We were not able to get to see a gynecologist because you cannot afford it. You are not able to go to good hospitals because you cannot afford it. So you tend to go to available hospitals, and to the available hospitals, you'll get answers that are not really helping. And that really is draining. And the visits to the hospitals for pain reliefs and everything, it is draining in terms of finances, and also in terms of work, it is draining.
Thank you.
Because I am a beautician by profession, and sometimes you have bookings, but you cannot tell if tomorrow you're going to wake up strong or not. And sometimes you have the booking, but you cannot attend to that client. And some clients, most of them will not understand it. They will take it as if you're not serious with your work, and you're not competent. And yet you know your potential, you know you can do it. But unfortunately, this monster is putting you down. But what makes me strong is I wake up and tell myself that Endo will not define me.
Absolutely.
I will define Endo.
Absolutely.
And I am a warrior.
Absolutely.
Yeah.
Thank
And
you.
lastly, I will say all of you ladies who are here and who are not here, you're beautiful. I know sometimes you tend to forget that, but you're beautiful. Always remember that.
Thank you, and so, as are you. And thank you for so bravely sharing your story, and it's true. And this is where we wish that, the government, hopefully we can, one day we can sit here and say that the government played a role in helping our journeys ease up a little. Amen to that. Hi.
Hi, ladies. My name is Edna. My name is Edna. Okay, the word I can use is heartbroken and strong.
I like that. Heartbroken and strong. I love that, Cecil. And you're the pivot.
Yeah. The reason is I've gone through this journey for almost 14 years and 4 surgeries, expecting the 5th one. Strong. So I keep on pushing. Don't want to fall. So in the first, I've gone through a lot. I've seeking so many medical attention, but some they are telling you this one, some telling you this, even where the surgery is not supposed to be done. Some decided even to do, like for all these 4 surgeries, I've lost 1 ovary. And also the 4th surgery was a very, very difficult surgery for them to do. So that's where I've stayed. I've not gone for the 5th, I think. Also the finances. Some also I don't know if they saw me in the TV. There is another day when I went there to ask for financial because something draining. Also, I'm appealing we go out there so that people can understand what endometriosis is, because everyone, when you tell somebody that you are suffering from endometriosis, it's asking, what's that? Please, can you explain what's that? So I'm appealing, we go further. And also, I can say that endometriosis has made me to change. I didn't want to be a nurse, but I'm saying that I want to go to study for nursing so that I can work in the Center for Endometriosis.
That will come true. We'll make sure it comes true. We'll make sure it comes true. Be prepared, okay? Thank you. And thank you so much for sharing your story. And you know, your CISO will lead you to hopefully what's available there. Okay, thank you. Hi.
Hi. Let me stand. Hi, everyone. So I go by the name Meridana Mbuya. You can call me this Mbuya. And my word is debilitated, just because sometimes I always feel powerless or unable to function. So we all know the stigma that comes with endometriosis, right? As you can see, this is my belly. Yeah? We all know about endobelly. So I just want to say something. I remember there was a time I used to live with my relative, and she could not understand about endometriosis. And sometimes you always know how constipation with endometriosis, how they connect. So this one time I'm in pain, and then I tell my auntie, because I knew she was a woman, she could understand. I told her, hey, auntie, I'm in pain, nini, things like that. Do you know what she told me? I don't know if this is the right word to use, or she told me, hizo ni mapupu zimejaa hapo, hiyo si endometriosis. So I felt so bad, but I thank God for my mother. My mom is my hero. My mom is my #1 support system. Despite the fact she doesn't know to pronounce endometriosis, I love her, you know. So, yeah, guys, the stigma with endometriosis is tough, but we should be strong at the same time. One thing I'm going to tell all of you that I always tell myself is the quickest way to recovery is self-acceptance. Always accept the situation. Just, I don't know, but I know you have understood. And I also thank Doris for the appreciation. What does it say? Happy Appreciation Day, ladies. Yeah, I thank God for Doris, because the moment my aunt told me that, I felt like, because I was like, inaweza kuwa ukweli ni mapupu. Inaweza kuwa ni ukweli by the way na nitaangalia, but what could I have done? Then I went to the group, and then I saw the message that Doris wrote, and I was like, kwenda huko sasa wewe tunanisaidia na nini. So yeah, you can go and search me on Instagram at this Mbuya. I have my poem about endometriosis right there. You can listen to it, and thank you.
Thank you so much. Thank you for sharing your story, your word. Also, remember, be mindful. Remember, sometimes a lot of these comments and advice that comes from people who don't actually understand it as well. So, you know, it's not their fault. I know we take it personally because it's directed to us, and it pinches us because we're the ones going through it, but we have to look at that perspective, because then it makes it easier on our mental health and how it affects us. Everything we're doing, every mindful act is for us, not for them. Yeah? Thank you. Yes, hi. Sorry.
Hi. My name is Wange Shinjora. My word is overwhelming. I feel this almost, not every day, almost. I'm 1 year, 4 months post-surgery. I thank God for my boss. He introduced me to Dr. Yamal. He's a man. And he was like, Caro, you know, you should see Dr. Yamal. And I'm like, why? Like, okay, fine, let me go. I booked an appointment with Yamal, and I got to know Dr. Njagi, and I had my surgery. And I feel so much better. I feel so much relieved. I'm not in so much pain like I used to. My pain used to be at 100. Right now, my pain is at a 10, 15. It's a pain that I can do without the painkillers. So I'm grateful. Thank you for this community, and thank you for everyone.
Thank you. Thank you so much.
Hi ladies, niko na homa sauti imeenda. My name is Mercy Chalangat. I'm the last one because I'm a journalist with the Nation Media Group. I was invited here to listen to your stories, to interact with this community. I have done stories before with Endo Warriors, and I know let me not say I know. Is understand the word? Okay. Let me say I know about. I know about the pain and the loss that you guys have experienced. And I want to just say I see you. You're very brave. I know from interacting with other Endo warriors who, some of them that I've spoken to have lost their wombs, they have lost pregnancies and things like that. So I want to say I see you, and I'm here to create awareness, more awareness about about this condition, and more grace to you. I pray that the journey gets easier for all of you, and I pray that God continues to give you grace and strength to endure. So thank you so much. If you need any help, if you need any help with your story, if you need your story told, please feel free to contact me. Thank you.
Thank you so much. I have only one request. This is to all the media. Can we not just do this on the month of March? Because we battle this condition 24/7, 365 days a year. Like every year, every day, every hour, every minute. So if we can continue to have this awareness, it's only then will it make an impact. Until then, come March, the rest of the year goes by, umesahau, come March again, haya imeanza tena. Okay? Thank you very much. Okay, so I want to, as we wrap up, the reason why we've been rushing to wrap up is because there's some food upstairs that's getting cold. Yes, but before that, I just wanted to wanted to do two things. Okay, it's a quick exercise which I really need all of us to try and do, because anytime it gets overwhelming, please just make sure you focus. Remember, what is this one thing that you have that is readily accessible? It is free of charge, and you can do it whenever you want. What is this one thing? Exactly, breathing. Okay, the minute we feel overwhelmed, the minute we feel lost, the minute we feel all the words that we've expressed, right? Come down to your breath, okay? So get into a comfortable space, okay? Just feel light, relax your body, because I'm hoping that after this session, all of you are feeling a little bit lighter. I hope, okay? As we coffee roll out. Okay, just put your hand on your navel. Yeah, just put your hand on your navel and just feel it, okay? I want you to take a deep breath at a count of 4. You hold your breath for 4 and you exhale out at 4. Okay, but be mindful about it. You can close your eyes if you want to. We're just doing it once, all right? So let's do it together, okay? Let's go. Let's go in a breathe. So as you breathe in, make sure your stomach comes out. It doesn't go in. In your inhale, your tummy comes out. You hold it, and as you exhale, your navel goes almost towards your pelvic floor. The reason why I'm doing this is one movement that also strengthens your pelvic floor. It's a pelvic floor therapy movement as well. All right? So let's go. Let's breathe in. 1, 2, 3, 4. Hold it for 4 counts. 1, 2, 3, 4. Now exhale slowly and release everything that you feel of today. At 1, 2, 3, and 4. Okay? Remember to do this. Practice it every day if you can. I don't know how you feel. How do you feel? Okay. Hopefully you feel good. Yeah, it's all that stuff that's coming out. Cough it out, man. Cough all those emotions out. Don't worry. Okay, this is the last thing that I want to leave you here with, okay? Tell me this one thing. I mean, actually, don't tell it to me. Tell it to yourself as you leave. If you could talk to your own body, what is the one thing that you will tell itself? What is the one thing that you will give itself? And what is the one thing you will do for itself? Do something, say something, express something for yourself. Okay? And with that, I conclude this amazing, amazing event. Before I hand it over to Felicitas, I want to thank each and every single one of you, because what you've come to do here is incredible. Sharing your stories is amazing. So I really, really appreciate you. I hear you, I feel you, and I walk this journey with you all. And thank you so much for everything. And thank you, Third Park, for this.
So, thank you, Arti. I'm not the person giving vote of thanks. Third Park team, come to the front. Time, all of you. Team support, come. This is our support team. And we appreciate you and we love you. Vote of thanks we are going to be given by Dr. Arti Shah. He's a dedicated hospital doctor at Third Park Hospital since 2022, holding an MBC HB degree with a strong background in clinical practice. Dr. Shah is currently serving as Acting Chief Officer, Operating Officer, COO, bringing leadership and strategic oversight to the hospital's operations. Passionate about healthcare excellence, Dr. Shah combines medical expertise with management skills to enhance patients' care and institutional growth. Over to you, Dr. Shah.
Thank you for that, Felicitas. Good afternoon, everyone. I'm going to make this very short. I know you've had a long session. So as we come to the end of this wonderful, powerful, and inspiring Endometriosis Warriors Unite event, I would like to take a moment to reflect on the strength, the resilience, and the unity we have witnessed amongst all of you today. Can we have a round of applause for all of you present here today? Can we make it louder than that? Thank you so much. From the insightful therapy sessions and the discussions today, this has reinforced one important message. You are not alone. We are in this together. Can we say this together? This together. One more time. We are in this together. So on behalf of the organizing team, I extend my deepest gratitude to our speakers. We had Mrs. Mildred Odiambo, we had Arti Shah, and Dr. Yamal Patel for sharing their knowledge, their experiences, and expertise. Your words have really educated us, empowered, and inspired all of us. A short round of applause for them. I also extend my thanks to our sponsors and our partners for their unwavering support in making this event possible. Their commitment to this cause is invaluable. I also thank our amazing volunteers, our videography team, and the organizers for their dedication, their hard work, their passion in bringing together this event to life. Every detail you see today is a testament to your efforts. Thank you so much. Last but not the least, I would like to thank each one of you present here today, the warriors, the caregivers, their partners, advocates, their supporters. Your presence and engagement and solidarity are what is making this endometriosis community strong. As we leave today, let's carry the knowledge, the support, and the advocacy. Let's continue breaking this silence, demanding better care, uplifting one another. The fight for awareness and better treatment doesn't end here. It continues with each and every one of us. Thank you once again for being a part of this incredible event. Safe travels, stay strong, and keep fighting. Together, we are unstoppable. See you all at the next Endometriosis Warriors Unite.
Thank you so much, Dr. Preet. I think we are done. Before we finish, Dr. Njagi has sent his regards. He's online watching. He said he loved all of you. My videographer has told me we have launched a song. We need to dance at least 3 minutes to that song. But before that, I would request a group photo here, and we'll have a photo session at the rooftop. We have a very nice view at the rooftop. So I request everyone to come to the front. Those who consented to photography, come to the front. Then Masharia will guide us on what to do next with the song. Thank you so much.